Ma'am Rose Ann. Ma'am Rose Ann, Ma'am Donisa, dito po kayo.
Yes po, ma'am.
Checking na daw po tayo sa YouTube, sabi ni Sir Mike and Ma'am.
Okay, wait po, mama. Hello. Hello, good afternoon. So in just a while po, we will start our webinar. We are just waiting for the others to join the link. While waiting, I'd like to remind everyone with our webinar's norms. Please be informed that this webinar is being recorded for documentation purposes. Stay in a quiet place where you will not be disturbed by others. Kindly mute your microphone and turn it on only when you are asked to speak. Use the chat box or comment section to raise questions or clarifications. And for those who are tuning in our official YouTube channel, AYALA's Pride, please don't forget to like, share, and subscribe. For the link attendance, kindly coordinate with your advisors in your respective class GCs. Okay, Ma'am Abby, can we start na?
Yes po, ma'am. Pwede na po. Thank you po.
Wait lang po ha. Antayin ko lang yung ating presentation.
Good afternoon, everyone. I'm Abby. Can I share my presentation na po?
Pwede na yes, sir.
Wait. May program po tayo.
Yes po.
Okay po. Sorry po.
Okay
sorry.
lang po. Sige. Naayos lang po yung ating presentation. For a while lang po.
Yes po. Pero sir, kayo na po magpe-present ng presentation niyo po.
Yes, ma'am. Ako na po.
Okay po. Sige po. May short program lang po, sir. Thank you.
Sure po. Thank you.
Ma'am, hi na. Okay na po. Wait lang ha. Inaayos lang po ni Ma'am Denisa. Sige, i-try ko po ulit mag-present. Wait for a while. Sorry, hindi ko po kasi ma-full screen, Ma'am Abby. Nawawala siya sa full screen. Kaya hindi ko siya maano. Wait. Nandiyan na po ba si Ma'am Denisa? Wait lang, Ma'am. Okay. Sorry, Ma'am. Kanina kasi okay naman kaso biglang nawala siya sa ano. Wait. Once again po, good afternoon to our school principal, Ma'am Rose Marie Ponce, to our invited guest speaker and resource speaker. Thank you so much for accepting our invitation. And of course, to our master teachers, parents, and students. All right, so once again, I am your host, Miss Rose Ann Toston. Following the outbreak of COVID-19 pandemic, government all over the world hastened to respond by enforcing measures such as social distancing, quarantine, and isolation. While necessary, these measures can have a significant event on everyone's mental health. Fear, anxiety, anger, sadness, and grief are compounded by being away from schools, work, peer, adjusting to new ways of learning and working, as well as fear of losing jobs and family income. For this reason, the Brigada Eskwela, in partnership with Disaster Risk Reduction and Management, or DRRM, Wash in School programs, or WINS, and Wellness Campus host our today's event with the title Webinar on Mental Health, Psychosocial Support, and Healthy Lifestyle Amid Pandemic. So, to formally start our program, let us have the patriotic song, which will be followed by the opening prayer to be led by Mrs. Idalyn T. Coliosa.
Ma'am Rose, nagdalag ako. Puwedeng pa-try?
Okay po, wait, try ko po ulit.
Good afternoon po. Naririnig po ako, Ma'am Rose Ann? Sige po. So tayo po ay mag-pray sa atin pong pagsisimula. Praise God, Panginoon, kami po ay nagpupuri at sumasamba sa iyong dakilang pangalan. Salamat po sa buhay at kalakasan na patuloy mong ipinagkakaloob sa bawat isa sa amin. Salamat po, Panginoon, na sa kabila ng mga pagsubok na aming nararanasan, kami nananatiling malakas at nakakapagpatuloy sa aming mga tungkulin sa bawat araw. Tinataas po namin sa iyo, Panginoon, ang amin pong webinar sa araw na ito. Ang bawat isang naririto na nakikinig at nanonood ay bigyan mo po ng bukas na kaisipan at bukas na puso upang amin pong maunawaan ang bawat bahagi ng gaganaping talakayan. Gayon din, Panginoon, tinataas po namin sa iyo ang bawat speaker sa hapong ito. Bigyan mo po sila, Panginoon, ng wisdom upang makapagbahagi sa amin ng mga bagong kaalaman. Let your Holy Spirit be upon us and guide us always. Ang tagumpay po ng webinar na ito ay inaalay din namin sa iyo. Ang lahat ng ito ay amin pong idinadalangin sa pangalan ng aming Panginoong Jesus. Amen.
Nakamute ka, Ma'am Rose Ann.
Naka-unmute si
This time, may I call on our dynamic and ever-supported school principal, Ma'am Rosemary Ponce, for her opening remarks.
Thank you so much, Ma'am Rose Ann Toston. Magandang hapon po sa ating lahat. Blessed afternoon to our honored guest, Sir Kersipel Retoriano from FEU. Tama ba, Mang Abi? Of course, our very own speakers, Sir Gilbert Mendoza, Sir Isabelo Binala Jr., to all my beloved MRAIS teachers and all participants to this webinar, isang mapagpalang hapon po sa ating lahat. Kamusta na po kayo? I just hope and pray that everyone is safe and sound, physically, mentally, emotionally, spiritually, and psychosocially. So this afternoon, I would like to welcome everyone on board this virtual platform for a very important webinar as we learn and dig deeper into the importance of mental health, psychosocial support, and healthy lifestyle amidst this pandemic. At the onset, I would like to express my sincere gratitude to the BRIGADA ESKWELA team headed by our newest master teacher, the newly promoted Master Teacher 1, Ma'am Abigail Banigon. Congrats, Ma'am Abi. Congrats. And thank you so much for pushing through with this very important webinar. Maraming salamat po sa lahat ng partakers and participants to this webinar. Thank you for your time and effort and for sharing an important time for this worthy endeavor. Again, welcome to this webinar and happy learning, everyone. Good day.
Thank you so much, Ma'am Ponce, for that warm welcome. So at this moment, let us have the introduction of our resource speaker with Ms. Abigail A. Banigon, our overall chairman of BRIGADA ESKWELA.
Thank you, Ma'am Rose Ann. So, to our beloved principal, Ma'am Rosemary P. Ponce, our master teachers, my fellow teachers, parents, and learners, good afternoon. Our resource speaker is currently Instructor 4 at the Department of Medical Technology at Far Eastern University, Manila. He holds a master's degree in public health from the University of the Philippines, Manila, BS Medical Technology from the University of Santo Tomas, professional teaching certificate from the University of the Philippines Open University, and presently completing his master's degree in education, major in educational management from the St. Jude College, Manila, as his second master's degree. Aside from teaching, his work experience includes being a medical technologist and HIV proficient analyst. To talk about healthy lifestyle and stress management during this pandemic, I am proud to introduce to you Sir Kerfer Selby Retoriano. Okay, let us all give him a round of virtual applause. Take it away, sir.
Thank you very much, Ma'am Abigail, for that very warm introduction. Let me share first my screen. Okay, I would like to ask if you can see now my screen.
Yes, sir.
Okay. Before I start, I would like to take this opportunity to thank you, Ma'am Abigail, for this opportunity of having me as your one of the speaker in this webinar. And I would like to greet a pleasant good afternoon or to our principal, Ma'am Ponce, and to the master's teachers, the head teachers, and of course the teachers of the AYALA, Margarita Rojas de Ayala Elementary School. And of course, to our parents who are logged in, and of course, to our dear students who are tuning in. I'm very excited. Ito po yung aking first time to be talking in front of elementary students. I usually do lecture webinars sa mga college, no, or all older population, pero this is my first time. That's why I'm very excited to share the knowledge that I have and experiences in terms of a healthy lifestyle amidst COVID-19 pandemic. Again, thank you, Ma'am Abigail. So again, my name is Kerfel Saldatoriano. You can call me KR in short. Ang buong pangalan ko po I got this from my parents, father's and mother's name, a combination. And I've been teaching for quite some time for sa FEU for almost 10 years na rin. So from hospital, I shifted career in the academy. And so far, I'm enjoying teaching. So for this afternoon, ang aking i-discuss po ay about healthy lifestyle. Although I'll be focusing more on the ways to reduce anxiety and depression in relation to online learning, no? Because this is one of the relevant topics today, no, in COVID-19 pandemic era. All right. So before I start, no, I just want to encourage everyone to participate. So as a rules of engagement, uh, please do unmute your mic if you have questions, or you can just jot down notes sa ating mga students, and you can just ask the question after the webinar. Okay, thank you. So COVID-19 is one of the unprecedented event in the history natin in terms of health emergency. The entire world caught off guard last March 2021. 2020. Initially, this was uh, perceived to be just a non-virulent virus, but it turns out that it became a global pandemic, no? Global pandemic, because we have different terms to use, no? Pag pandemic, it's worldwide. Epidemic is in one place lang, which is originally in Wuhan, China. But then, since coronaviruses, no, the COVID-19 or the SARS-CoV-2, the transmission of this virus is very efficient. That's why it spread in an exponential number through all the countries, in a little short span of time. Like it was discovered November, and then WHO declared pandemic March na po. Or actually, if I recall that correctly, last week of February pa lang, they are declaring already a global pandemic. So as an effect, um, according to UNICEF, there are 168 million children affected. But these numbers continue to rise, although I know that majority of educational institution from basic education and higher education are now um, implementing uh, prevention, no, in terms of students who are dropping out of classes kasi the shift from face-to-face classes to online classes talaga is really hard because our country is not prepared in terms of the technology and the physical facilities, like for example the computers that we have. So that is very understandable since um, we are classified as a third world country. The good thing is like what the DepEd is offering now, and I'm very happy to see this types of modalities, no, different types of modalities because we don't have this in the higher education. So I just wish na sana in college students meron din kami nito yung mga different modalities. So that's a very good strategy to to mitigate the negative effects of COVID-19. So as the students emerge in the online learning, one of the issues that is not commonly addressed or being talked about by the government is the health of the students. So the definition of health, according to WHO, is a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. So when you say a person is healthy, it means that the person is physically, mentally, socially healthy. This is in contrast to the yung common notion natin na pag yung healthy, no, medyo hindi siya masyadong malaki, no, maskulado, hindi po ganoon. Pag sinabi nating healthy, it also involves mental and social well-being. And in my opinion, as a public health expert dito, because I'm doing also some of the programs here, I'm also helping, no, in doing some programs, especially for infectious diseases. I think this is uh, this is one of the major topics that the government should look into. No, I mean we avoid the virus, but we tend to forget the other diseases or conditions that a person might acquire during, for example, when they attend online learning. So let's talk about the different components of health. No? To understand it further, let me talk about the first component, which is the physical health. So by definition, it is the overall physical condition of a living organism at a given time. It means your physical health today may be different tomorrow and in the next few weeks. It is the soundness of the body, freedom from the disease, abnormality, condition of optimal well-being. It is when the body is functioning as it was designed to function. Halimbawa, so COVID-19, how do we know that we have COVID-19? 'Di ba nawawalan tayo ng panlasa. So that's one of the symptoms of COVID-19. And that is also included in physical health. Another, uh, hindi ka makatayo, which is dapat nakakatayo ka, 'di ba? And another, um, students who are exposed to computers for more than 8 hours tend to have eye strain. So yung iba nagkakaroon ng grado or tumataas yung grado na may mga grado na. So that's one of the examples of how do we define or describe physical health. So components of physical health include, no, number one here is of course exercise. This is a basic foundation in terms of maintaining our health status. Online learning, we tend to be sitting all day, and that's I think that's one of the most uh, significant predictor of health. No, yung sitting all day. Kasi sabi nga nila, sitting is the new smoking. So, yung pag-upo ng buong araw, hindi siya mas nakakasama siya sa katawan natin. So one way to prevent that is to be physically active, and standing once in one uh you should stand at least, no, once in 1 hour or 60 minutes. Basta dapat tatayo ka, hindi pwedeng nakaupo ka lang the entire day. So physical activity is one. However, this is a big problem nowadays because we are restricted to our homes. Kaya kailangan talaga we find ways to be more physically active at home. So pag-uusapan natin yan in a little while. Maraming klase ng uh, pagiging physically active. So we have moderate, vigorous, no, vigorous sports or recreation, muscle fitness, flexibility exercise. So sa mga students like grade elementary students or even in high school student, what we can do is to do moderate physical activity. So at least dapat, no, 7,500 steps or sabihin natin ay na gumagawa ka ng ibang household chores like pagwawalis, no, or ultimo paghugas ng plato, basta dapat mobile ka, no, hindi ka sedentary. Remember that majority of people now, no, this goes to all ages, not only to students. I think all people that I know, no, majority gain weight. Why? Kasi nasa bahay ka lang, no, hindi ka makalabas, and then normally nakaupo ka lang din ulit, and then um, ah, magkakasama kayo sa bahay, so ang tendency, yung magulang nagluluto na nagluluto. So okay lang 'yon. Okay lang 'yon. But always remember this. Okay lang kumain ng kumain. But this is always the principle. Energy in, energy out. So kung ano yung kinain mo, dapat gagamitin mo rin siya. For example, if you're eating 1 cup of rice, that's approximately 120 calories. So 120 calories, you need to burn that. And do you know that when you sleep, no? When we sleep, every hour, 20 calories lang ang nababurn. Kapag nakaupo ka lang, it goes down. So mas bumabagal yung metabolism mo. So if you want to burn that 120 calories, you need to walk, you need to be physically active. So ang tendency is that when you eat excess to the need of your body, no, the glucose, for example, the glucose is converted to glycogen, and the excess glycogen, no, ito nako-convert siya sa fat. Ang tawag doon lipogenesis, no? Lipogenesis. Isipin niyo yung kanin, nako-convert siya sa fatty stores. Kaya the first sign that you are eating in excess is what? Lumalaki yung abdominal area natin. That's the first sign. So the first sign the person is eating in excess is what? Lumalaki yung abdominal area. Yung waist-hip ratio tumataas. No? Then ano yan, susunod na yung kamay, paa, and then yung mukha. So energy in, energy out. Sa mga students natin in the audience, I highly suggest that you must eat first before attending class kasi it will give you enough stamina during long lectures. And then, if if you're planning to study in a longer period of time, if you're attending, for example, a class, I suggest that you eat ano lang, small proportions lang. Wag yung bulk na eat. Wag na bulk na eat. Wag na yung bulk na kain kasi aantukin ka talaga. No? That's part of the digestion process na ating katawan. So again, energy in, energy out. A perfect example that I always give my student is that kung kakain ka ng Skyflakes, 3 crackers lang yon. Do you know that the 3 crackers of Skyflakes is equivalent to 1 cup of rice? So, every time na magugutom ka at sasabihin mo, kakain ka ng Skyflakes na lang ako, ayoko mag-rice. Mag-rice ka na lang kasi it will give you more satisfaction. It will give you more satisfaction than eating 3 crackers, no? So always look at the nutrition facts of all the food that you eat. That's the calorie counting natin na ginagawa. So another is nutrition and diet. Yan. In connection to the physical activity natin, no? One of the effects of the pandemic is the excess eating. No? Excess eating. And one of the negative effects also is the economic part kasi maraming mga families, no, parents ang nawalan ng trabaho talaga. So ang nangyayari, mababa ang income ng isang family, mas less yung option nila sa pagkain. So they tend to select foods which are pasok sa budget, no, yung mas mura. And that's one of the problem. But kahit sabihin yung maliit lang yung budget, we can always find ways, no, to select more healthier foods. Now, as parents, of course, it's our obligation, it's our duty to be a planner in terms of the diet. Kasi tayo yung nagluluto. For example, yung mga mommies and daddies, ako, nagluluto ako. So, I really plan kung ano yung lulutuin, no? So, as much as possible, diversify your diet. So, it means pag kumain ka ng tinapay sa umaga, huwag ka nang kakain ng tinapay sa tanghali, saka sa hapon. Ibahin mo naman, like mag-fruits ka lang. So, nutrition and diet is very important in children or in school age children, particularly elementary school children, because the food that they eat influences their cognitive performance. Because let's say undernourished children, no, and malnourished children, based on literature, they tend to have a poor performance compared to those who are not undernourished or malnourished. And then, hindi rin na ma-maximize yung capability ng isang estudyante kapag ano din siya, underfed or hindi siya malnourished siya. Okay? So the diet is very important. So iwasan yung mga junk foods, no? Iwasan 'yan. Um, I know this is very difficult kasi sa totoo lang ang hirap na gumawa ng program pag sa mga non-communicable diseases like diabetes kasi tayong mga Pilipino, ano tayo, we are natural eaters. Talagang mahilig tayong kumain. So the 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 solution is, no, you just minimize, no, don't remove that. You just minimize your intake. So that's for nutrition and diet. I'll go back this on this slide later. Yan. Components of physical health also include alcohol and drugs. So, of course, ako as a drug analyst for a couple of years, LTO, I've met a lot of people who are taking shabu and methamphetamine. So, sa mga estudyante natin dito, ito yung mga tinatawag natin na illegal drugs na bawal i-take. No? Sabihin na natin na nakakasira talaga ng buhay because people tend to be addictive. So, those who are smoking, mahirap yan. So, I know that wala naman akong alam na nabasa pang balita na mga elementary umiinom na ng alak or nagyoyosin or nagte-take na ng marijuana or shabu. So I'll be saying this sa mga parents that this is a very important reminder that don't smoke at home. Huwag kayong magyoyosi kasi meron tayong tinatawag na primary smokers like ako, magyosi ako. And pag nagbuga ako ng usok, second hand smoke na siya. Pero alam niyo ba, meron pang third hand smoke. Ito yung amoy ng yosi na dumidikit sa ating mga damit na halimbawa, pag dumikit siya, uwi ka ng bahay, pwede pa rin maamoy yan ng mga bata. So it also exposes the children to unnecessary negative effects of smoking. Next, rest and sleep. Of course, students dapat you have an adequate sleep. No? Sabi nila, 8 to 10 hours talaga yan. And this is a very important reminder again to students that huwag po kayong magpupuyat kasi um, lack of sleep diminishes our optimal performance in school. And alam nyo ba, meron akong trivia dito sa mga students natin. No? Alam nyo ba na ideally, pag natutulog talaga dapat, lights off. Ayan. So, may tanong ako sa mga students natin, no? Kayo po ba pag natutulog kayo, lights on, lights off? Lights on, lights off. Can I hear someone from the audience na ating estudyante?
Lights on.
Lights
Lights off.
on. Lights on, may lights off. Okay. Sa sumagot ng lights on, alam nyo ba na ang students, since you are school age children, meron pa kayong malaki yung potential nyo to grow taller. And that's because of your growth hormone. Did you know that the growth hormone release is higher? Mas mataas yan kapag tulog ka at naka-lights off ka. Because dark environment, ini-stimulate niya yung ating pituitary gland to release more growth hormone. And in addition to that, if children are sleeping no, in the afternoon, if the children are sleeping in the afternoon, it also helps the release of growth hormone. Kaya nung nagtuturo ako ng clinical chemistry sa mga estudyante ko nitong ito na nagtatrabaho na ako as a teacher, na-realize ko yung sinasabi sa akin palagi ng magulang ko. Sabi ng mami ko dati, sabi niya, "Matulog ka sa hapon." Ayan, yung pala yun, na ang pagtulog sa hapon talaga ay nakakatulong sa paglaki ng isang bata. Kaya totoo pala siya. Sana pala kung nalaman ko lang yun agad, natulog talaga ako 'no, 12 o'clock pa lang hanggang 5:00. Pero of course, hindi siya puwede sa ibang estudyante or sa ibang household. So yun lang, trivia lang po siya. And of course, don't, uh, don't sleep ng very, very late kasi it also increases your cortisol. So yung cortisol na tinatawag natin, ito isang hormone. So 'pag puyat ka, 'no, 'pag puyat ka, ano siya, it is secreted by your adrenal gland. No, yung adrenal gland sa may kidneys natin kung saan pinapataas niya yung blood sugar mo. So parents in the audience, um, our sleeping pattern also influences the sleeping pattern of our children. Kaya mas maganda talaga na we practice sleeping on time. No? Sleeping on time. Kasi yung pag nagpupuyat, yung circadian rhythm na tinatawag natin, no, ulitin ko, circadian rhythm, it disrupts the release of the different hormones in the body. So ayan, no, tulog. So pag ang estudyante nagpupuyat, tendency sa umaga, pag sa class, tulog. Ako, I always tell my students, no, yung mga estudyante ko na huwag kayong magpuyat kasi the reason why you're attending class is to learn something, no? To practice your critical thinking, no? Your analytical thinking. So, kung kayo matutulog lang sa klase, it loses its benefit, no? Sayang naman. Yan. So we're done with the physical health. So physical health, yan, sleep, exercise, your diet, and nutrition. Now we go now here in the another component, which is mental health. I think this is one of the underrated topics today kasi it is a common stigma, no, sa ating mga Pilipino na kapag ikaw may mental health problem ka, ang notion ay baliw to. No, mental health comes in different forms. No, it's a wide spectrum of diseases that affects our brain. Hindi lang siya na pag sinabing may mental health ka, ay naku, baliw to. No, mali po yun. So, sa ating mga estudyante, wag po kayo magbibiro na, ay baliw to, ganyan. Kasi mental health is really a serious issue. And to set the record straight, mental health, I think, is the number one non-communicable disease along with diabetes and hypertension at this time of COVID-19 pandemic. Kasi the COVID-19 pandemic really triggered mental health issues, no, for some individuals. Kaya if you are mentally healthy today, be really thankful. No? Be really thankful. So by definition, ano ba yan? It is a state of well-being in which an individual realizes his or her own abilities, can cope up with the normal stresses of life. I think this is one of the most important line, no? Can cope up with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Bilang estudyante, no, since full-time student ka, no, although may mga estudyanteng at an early age nagtatrabaho din, ano tayo, we are at our peak in terms of productivity kasi wala ka pa masyadong ibang iniisip. So, if you have if you have a mental health problem, then it also affects your performance. It also affects your performance. Although, ito kasing problem natin dito sa mental health is a multifactorial. Marami po nakaka-apekto rito. So, ito po yung definition natin. But, ito, no, I think sa students natin in the audience, please always remember this. Can cope up with the normal stresses of life. Kasi, our life, kapatid niyan talaga ang stress. It's just a matter of how you cope up or how to deal with the stress. Hindi siya mawawala talaga. So, according to the psychological health education components, mental health is significantly influenced by biological factors, psychological, and social. So I'll go first with the biological, our physical health, disabilities like hearing impairment, no, eye impairment, genetic vulnerabilities for those who have different genetic problem, no. For psychological, we have self-esteem and coping skills. Pag social naman, we have family circumstances and peers. Itong biological, this is majority innate. No? We cannot do something, we cannot do, it's very difficult to manipulate these factors. Pero itong social and psychological, somehow we can still ano to, manipulate them. For example, family circumstances, no? Sa sa mga parents natin in the audience, our our role as a parent is very crucial to the success of our child. Kasi yung attention na binibigay natin sa mga anak natin, it it plays a predictive, no, factor sa kanilang performance. So a simple kamustahan lang or support, no, habang kunyari yung estudyante nag-online class and then ikaw you prepare the food, no, pag break bibigyan mo pagkain. That's a very good ano social support, no, sa mga students. So in between there are factors that are affected by two or three components. So like for example, if a child is taking drugs, no, or if a student is taking drugs, it affects their social and biological characteristic. No, students who are addicted to drugs, for example, they tend to be more aloof. No, they tend to have lower quality of relationship with their family. And then temperament naman, IQ, it also affects your biological, affects your biological and psychological, and then family relationships and trauma. So kung titingnan natin itong component natin na to, sobrang dami na nakaka-apekto sa ating mental health. So there are factors that we cannot really make a solution or remove, but we can minimize its negative effect. Yan. Sa mental, one of the ano natin, no, characteristics natin being healthy, mentally healthy is when we recognize our current mental health status, no? Dapat marunong ka mag-recognize. Are you depressed? Are you nervous? Are you afraid? Are you stressed, tense, lonely, distressed? So dapat alam mo na kung ano ba yung talagang nararamdaman mo, no? Sa mga estudyante natin in the audience, um, I would understand if you're a little bit confused sometimes kasi you're not really achieve your full maturity in terms of the different organs of the body natin, especially the brain. Kaya okay lang 'yan. Pero dapat medyo familiar na kayo kaya depressed na naman ako. Now, ang next question, ano ba yung bagay na nakakapagpa-depress sa'yo? So dapat alam mo yung nagti-trigger, yung nagsi-stimulus. And third, of course, dapat alam mo kung paano mo siya masusolusyunan. Kung nagpapa-depress sa'yo yung ganito, dapat alam mo kung paano mo siya maka-counteract. No? For example, you are very nervous when it comes sa exam. So, bakit ka ba nervous? Hindi ka ba nag-aral? So, kung hindi ka nag-aral, mag-aral ka. Ngayon, kung hindi ka nakapag-aral, then that's another issue. So, that's a time management issue. So, dapat you can write this in a notebook, no? Ano ba yung nararamdaman mo ngayong araw na 'to? And sometimes it's very helpful to talk to someone who is older than you, like your parents. I highly suggest that yung tayong mga estudyante na 'pag tayo naguguluhan, we always talk to our parents first dapat. Kasi for me, they're the best point person, no? Next. According to the research for college student psychological health education model under internet environment noong 2016, ito daw yung mga structure or components daw ngayon na nag na out na result because of the digitalization of learning. So students tend to develop a high level of depression, anxiety, stress, no? suicidal thoughts, poor school performance, learning memory problem, mood disorders, fear phobia, psychological, emotional, behavioral problem, enhancing skills, family relation problems, lifestyle management issues, sleeping, eating disorders, low self-esteem, anger, conflict management, and again, depression. So, in terms of online learning, in my opinion, this is just my opinion. Uh, I'm not a uh, I'm not against online learning, but in my opinion, online learning requires a certain level of maturity sa part ng learner. So, in terms of sa ating mga elementary students, of course, we cannot expect full maturity when it comes sa learning, no? That's why it is really recommended that parents support their students in their schooling. Kaya nakakatuwa man sabihin na yung minsan yung mommy mo yung gumagawa ng modules mo, ganyan. Okay lang yun kasi at least tinutulungan ka ng parents, no? Tumutulong yung parents. But not to the point na yung anak hindi na talaga gumagawa ng module. It should be a guided, no? It should be guided, not not depending only to the parents. But for sa example, for college students, of course, yung online learning, of course, is I think based on maturity level, it's very applicable. So we are now at the verge of industrialization, no? Or uh, education 4.0, and itong mga problems na to sa framework na to will be more uh, will be more evident at madadagdagan pa to for in the next few years. Now, dito tayo sa social media. So one way is to prevent depression and anxiety is yung students natin or tayo mismo dapat po ay tayo nagre-regulate tayo ng ating social media utilization. So alam nyo, social media or Facebook for me is junk food for our soul. Did you know that even though you're just scanning your Facebook, it has an effect sa'yo emotionally and psychologically, no? Meron siyang effect sa'yo emotionally and psychologically. Minsan, ayaw mong mainggit, pero at the back of your mind, pag nakakita ka, for example, ng taong may pinost na bagong bili or may pinuntahan, naiinggit ka. So, students are very vulnerable when it comes to this. In addition, no, uh, 80% of information in social media are not reliable. So I always tell my students also that be critical when you are reading or sharing posts sa social media kasi most of them are not really valid, no? Especially now itong COVID-19 pandemic, ang daming naging expert, no? Ngayong linggo, maraming virologists. The next week, marami ng mga political analysts. Tapos every week, maraming nagiging ng mga expert talaga. So it's okay for students. It's all right to have your social media, but always establish a clear line, no? When it comes to the effects to yourself. So meron ka palaging perimeter na hindi ka maapektuhan. Kasi look at the picture, no? Some people really transform, no? After 1 year of using Facebook, nag-iba yung ugali nila, no? Or nagbago yung perspective. So that's one of the negative effects of social media. And maraming tao ang na-depress at nag-develop ang anxiety because of social media. So in terms of online learning, school learning is really challenging for some students, no? Kasi hindi lahat ng students have the same privilege with other students. For example, in the picture, si magkapatid may kanya-kanyang laptop, so hindi naman lahat may kanya-kanyang laptop, no? At may magandang pwesto pag nag-online class. Halimbawa, this student, ayan, parents in the audience, listen carefully. Etong estudyante na to is attending her online class. Pero carefully examine the picture. No? Carefully examine the picture. Yung table niya, masyadong mababa. Masyado siyang mababa. And tinan nyo yung kanyang posisyon, yung body structure niya, naka-slouch na siya. So, ergonomically speaking, no, hindi siya healthy. No, hindi siya healthy. So, parents in the audience na have the capacity to provide a better space for students to learn should consider the height of the chair, the height of the table. Ideally, pag ganitong online class, dapat ano siya, eye level talaga yung laptop. No, hindi siya nakaganon. And then the lighting is very crucial, yung ilaw kasi like this student hindi siya naka-eyeglass. So di natin alam kung may grado ba yung mata niya or what. So doon na lang naman, of course, this is always ano no, situational kasi again, hindi naman lahat ng students merong opportunity or privilege sa mga ganyan. Pero if you have one, then i-consider natin 'yan. Ayan, like for example, this one, no? This picture tells us lot of things. So ako, una ko nakikita rito is, yun nga, yung posisyon nila, no? Pag nag-aaral. Kasi, you know what? Your body posture affects your, attention span. You know, affects your attention span, the lighting. But then, on the other hand, I really appreciate this pose kasi, itong picture na to, kasi, even though tignan niyo, ano sila, hindi sila naka-laptop, mas maliit yung screen nila, yung mga student, they are still, they are very motivated to continue with their studies. So, ayan, tinutulungan pa ng magulang. Ayan. Ideally, parents in the audience, ideally, you should guide your child during online class. So, there's no excuses po talaga. Katulong po namin kayo dito sa sa online class, no? So, sinasabi man ng ibang tao na bakit magulang na yung gumagawa ng modules, then you're doing it the wrong way. Kasi dapat anak pa din ang gumagawa ng modules and the parents are of course guide on the side, no? Guide on the side. But of course, this is always situational. Baka wag niyo po akong ibabash ha. Ano lang po to, ideally speaking. And of course, ideally yan, yung posisyon dapat ay ergonomically the physical environment is of course conducive and healthy for the child. Ayan. Paano ba natin masasabi na yung isang bata ay merong mental disorder like anxiety? Yan. Appear to be more clingy than normal. Ano to this is age dependent. Of course, kapag mga school age children, may mga isip na sila, may isip na kayo, 'di ba? Ito applicable tong normal to kung ikaw ay 1 or 2 years old, no? Be restless and fidgety, complain of stomach aches, display changes in eating and sleeping habits. Ayan, number one is yung insomnia, no? Tapos hindi sumasabay ng kain, express negative thoughts and worries. So as parents, we must be vigilant on this one. We should identify early signs of negativity sa ating anak. Get upset or angry more quickly and have bouts of unexplained crying and struggle to concentrate. In this 8 signs and symptoms, no, I think common is the struggle to concentrate kasi hindi naman lahat ng student may kanya-kanyang study area, no? So, ang hirap talaga, it's really a challenge to the child. So, the only way that we can help them is to cheer them up, no? Cheer them up. Yan, ways to promote mental health. So, number one is early childhood intervention. So, sa bahay pa lang, dapat ay nagbibigay na tayo ng magandang conducive environment for our child. So, kahit sabihin niyo na wala kang pera, marami pong paraan to support our child. Actually, maraming estudyante, no, in private schools that are very privileged, pero still, children tend to have problems, no, in terms of academic performance. And this is also applicable sa higher education. Second, opportunities for early learning, interactions that are responsive, emotionally supportive, and developmentally stimulating, support for children, mental health promotion for schools naman to. No? Like this one, this activity is a very good example. And this is a constant reminder to all the students in the audience that rest is just important as the work or as work. So, yung, and of course, the parents natin in the audience. So, ang pahinga is, ano to, very important, especially at the time of pandemic. I know that students tend to have a higher workload kasi online class. Honestly, I took my certificate in teaching online sa UPOU And that was ano 'no, 2014 pa. Matagal na. And then honestly, hindi ko binigyan na ano siya, I underestimated online learning. Yun, that's the perfect description. I underestimated online learning kasi akala ko, madali lang online learning. Online lang naman yan. Tapos at your own time pa. But then, when I took the subjects, eto na. Mas toxic pala ang online learning sa face-to-face. Pero, pero, it it makes me learn more, no? It triggers my critical thinking lahat, no? The other cognitive faculties. Pero kung nahihirapan kayo sa online learning, natural lang po 'yan, no? Mahirap talaga siya pero as you go along, masasanay yung katawan mo kasi ano lang naman 'to, it's always, exposure and constant training, 'no, sa mga estudyante. Kaya 'wag kayong, matatakot magpahinga. So dealing with stress during COVID-19 outbreaks, according to this World Vision, this is for children specifically. So I'll just run through sa isa-isa. It is normal to feel sad, distressed, worried, confused, scared, or angry during crisis. So um, normal lang na makatakot ka, makaramdam ka ng pagod, inis, no, or nalilito ka. Lahat po normal po 'yan, no? Even adults experience that also. Next, talk to people you trust, contact your friends and family. Ayan. As I've said, your parents, your kapatid, your brother, sister are the best person for you to talk if you have problem. And also, always consider to whom you are talking. No? Kasi hindi lahat ng tao may opinion, pero bilang lang po doon yung dapat mong pakinggan. Okay? Stay at home and maintain a healthy lifestyle. Keep in touch with family and friends through email, phone calls, and making use of social media platforms. Ayan. This is I think one of the positive effect ng social media in COVID-19 pandemic kasi yung mga mas madaling mag-usap-usap ngayon 'no, kasi pare-pareho kayo nasa bahay. So you can ano, you can exploit this, uh, way to communicate with your loved ones. Next, don't use cigarette, alcohol, don't do drugs. Next, if you feel overwhelmed, talk to a healthcare worker, social worker, similar professional, or trusted person in a community. So, parents in the audience, you must be able to identify that if your child is suffering from any mental health issue and kapag hindi talaga na nag-improve, then you must seek medical attention. Next, have a plan where to go and seek help for physical, mental health, like as I've said. Next, get true facts about your risk and how to take precautions from credible sources. Ayan, marami pong naglabasang fake news ngayon when it comes to COVID-19. Kaya, as I've said, it is it is important to be critical about the information that you read over online. Next, is a time that you and your family spending or watching upsetting media coverage. Ayan, iwasan manood ng di ko sinasabing iwasan manood ng balita, pero iwasan yung manood ng mga negative videos that can ruin your day. Next, draw on skills that you have used in the past during difficult times to manage your emotions during this outbreak. So yung mga hobbies ninyo na ginagawa before that makes you feel better. Okay, parenting during pandemic. So this is specifically for parents naman. Okay, mabilis lang po to, no? Number one is notice what's going well. Ayan, sa mga parents, no? We must always check our child. So appreciate them, give extra encouragement or high five praises, go along the way. So kahit perfect siya sa isang quiz, pag perfect siya sa isang quiz, yan, praise the student. Minsan, one word can make a difference talaga. And ano yan, this is proven talaga even in adults. Get down on their level, no? Sit on the floor and play yourself, be goofy. So, hindi ko naman sinasabi dito na magbalik toddler ulit, no? Pero, of course, ano siya, it's always uh, situational, no? So, parents should always look into their children by appreciating ulit their tasks or their activities, no? Be involved. Take a step back. It's okay to take few minutes when you are feeling overwhelmed. So ako, I understand if ang parent talagang sisigawan ang estudyante, pero siyempre hirap na yung mga estudyante kaya siguro habaan na lang natin yung pasensya natin. We're all going to mess up, reset, and move on. So if there's something happen, then talk about it, then move on. Next, plan. Make transition easier by talking together about what's happening next. So it's really helpful if parents are involved in the timeline of or work schedule of the students. Give their good direction. What can my kid actually do in their current mood? Choose non-reactivity. Notice your emotion before responding. Ayan. Minsan may mga type of school age children that are very sensitive. So, minsan may gusto silang sabihin pero pag nakita nilang may nakasimangot na yung parents, ayaw na magsabi. Be generous with affection. Ayan. If there's one thing that the pandemic taught us is that life's too short, no? You'll never know when that person, when we did the last time, you will see that person. Marami tayong mga ano, no, kilala na kausap mo lang ngayon, tapos bukas makikita mo nasa ano na, crematory room na, no? Actually, yung Facebook, hindi ako nagbabawas ako ng Facebook kasi parang naging ano, ah, puro gano'n yung nakikita kong post and it's really ano, it gives you mga negative effects. Alam niyo ang tawag do'n, transference, no? Transference. So, na-transfer sa'yo yung negative energy or negativity or negative thoughts na nababasa mo or ng taong nagsasalita sa'yo. Kaya it's advisable that it's advisable that you avoid them. Yan. Okay, this is very fast. These are the ways to reduce anxiety and depression at home. So this is just a recap ng mga iba kong sinabi kanina about physical and mental health. So number one, get exercise. Ayan. For school-age children, you can do a simple stretching. Dapat every hour tumatayo kayo, no? Do stretching, lakad, inom ng tubig, mag-bladder break kayo, no? So, huwag kayong upo ng buong araw lang. Or if you know other activities, yan. Mas pagpapawisan ka, mas maganda. So ayan. So as I've said, sitting is the new smoking. Ayan. How sitting wrecks your body. As soon as you sit, electrical activity in the leg muscle shuts off. So calorie burning drops 1 per minute and the enzymes that helps break down fat drops by 90%. So yung pancreas dito talagang no overwork siya. And then the good cholesterol drops by 20%. And then after 24 hours of sitting, insulin effectiveness drops by 20%, 24%. That's why the risk of diabetes is very high. Ayan, to my fellow teachers in the audience, alam ko mahirap sa part natin yung pagtayo talaga, pero we should find a way to stand up every hour or do something every hour kasi hindi talaga siya maganda, especially teachers who are at the age of 40 and above or those who are having their maintenance. Naku, talagang kailangan po ay maging physically active tayo or wag kayong upo ng buong araw talaga. It's not healthy. And aside from that, no, not to mention is that parents and teachers in the audience who are sitting, we can develop dito yung development ng varicose veins natin. So pwede tayong magkaproblema dito sa puso, no? Pwede tayong magkaroon dito ng embolism, no? So delikado 'yan. Okay, eat healthy of course. Dapat one half of your plates are vegetables and fruits, tapos one half lang yung rice, and then protein natin is one fourth lang din. So you can shift this, okay, depende yan sa budget ng bahay kung paano siya gagawin. But again, there are still many ways to be healthy or to eat healthy. So proteins, students, kailangan proteins ang priority yung kinakain kasi you are at the stage of growth and development. No, kailangan nyo yan. Carbohydrates, bawas kung ikaw naman ay upo lang naman buong araw. And yung ano natin, yung ating mga snacks, wag na kayong magchichirya. No? Okay lang na mag-crackers or mag-chichirya, pero once in a while, no? Pero choose fruits, okay? Okay, choose fruits na lang instead of junk foods. Again, okay lang mag-junk food basta regulated siya. And then, ways to reduce depression, anxiety at home. Stay connected, no? Talk to your cousins, talk to your friends. Yeah, that's very important. Instead of scanning Facebook, tawagan mo yung friend mo, mag-usap kayo, and to your classmates, of course. And wala akong makikitang picture kasi ng mga Pilipino, pero that's one of the best way, no, to loosen up your anxiety and depression. Explore hobbies at home. Yan, for children, probably you have a talent in reading, cooking, ayan. Okay, even walking, no? And gardening. So, you must know what's your hobby or yung bagay na nakakapagpasaya sa'yo. Yan. Siyempre, bawal na to sa labas. Eto, no? Kung kayo po ay nasa park at ikaw lang naman yung tao sa park, kasama mo yung magulang mo, okay lang na hindi na kayo magmask. So, this is information to everyone na ang pagmamask, dapat mo lang siyang gawin talaga kapag marami kang kasamang tao at kapag ikaw ay nasa enclosed area where the air circulation is very poor, like mall, buildings. Pero pag nasa park ka tapos malayo ka naman sa ibang tao, it's always okay to remove your mask. No? Pero pag malapit na yung tao, mag-mask ka na ulit. Reminder lang po that wearing a mask is not suggested for children 2 years old below kasi it affects their breathing. Okay? So, pwede pong wag mag-mask, basta open area. Tsaka, kung kasama nyo naman yung mga pinsan nyo, kalaro nyo sa isang bahay na hindi naman din lumalabas, it's okay na wag na mag-mask. Okay? Pero, pag may ibang tao sa bahay na pumasok, always wear a mask. Next, spend time with the nature. And of course, this is not really applicable now because may bawal pa rin lumabas ang bata. Pero siguro, breathe some fresh air. No? Uh, Parents in the audience, wag po nating ikulong ang bata sa bahay kasi marami din po negative effects sa mga bata. Kasi pwede po sila mag-develop ng vitamin D deficiency. So, sakit po yun sa buto. So, in the long run, pwede sila magkaroon ng rickets. Okay lang po ilabas yung bata, pahangin lang, and then magpa-araw from time to time. Also for adults, no? This is one of the conditions na hindi masyadong napag-uusapan itong pandemic kasi ang inis man tao, so I understand your fear of being affected by COVID-19, pero sunlight is also healthy. And meron na akong mga kilala na gumagawa ng study about vitamin D and COVID-19 severity of infection. So, breathe some fresh air. And of course, students, ayan, avoid procrastination. So, there are different ways to avoid procrastination. This is very effective to me, hanggang until this age. Create a to-do list. Dapat nililista mo lahat ng gagawin mo. And ako, for some reason, I am very fond of highlighting the tasks that I've finished. So, it gives me a satisfaction na, ito, tapos ko na to. Break down large tasks into smaller. Chunking ang tawag dyan, no? So, chunk mo lang siya. Huwag mo siyang gawin ng isang buong araw. Get rid of distraction. So, if you plan to study, huwag kayong hahawak ng cellphone o kahit ano. Doon lang kayo, focus lang kayo sa module. Pwede kayong manap ng study partner. So, pwede kayo parents, pinsan, ayan, kaibigan, barkada. Extend time when you spend studying on interval. So, for students here in the audience, meron tayong tinatawag na Pomodoro Technique. So, Pomodoro Technique is a studying technique wherein you take a break for every after 15 or 25 minutes. So, 25 minutes ka na focus or 20 minutes ka na focus and then you break for, let's say, 2 or 3 minutes. Tapos, balik ka ulit to avoid stress. Reward yourself. Ayan. So, pag nakatapos ka ng task, sabi mo sa mami mo na bilang ka ng shake or what, no? Para lang ma-rewardan mo yung sarili mo for a good job well done. So, again, to avoid procrastination, don't say someday, later, tomorrow, not sure, next week, first this, too tired, next year, after this. Do it now. I always tell this to my students that the reason why some students are being bombarded by tasks is that they don't follow their schedule. They don't follow their schedule. Okay? So, next, ito, ways to reduce, keep the household chores. Ayan, no, keep up with the household chores. Tulungan niyo yung magulang niyo, maglinis ng bahay. So, that's a very stress-releasing activity. So, ayan, nakakatawa, no? Naglalabas sila kasama yung magulang. So, enjoy nyo lang. Enjoy nyo lang talaga. Alright. Lastly, second to the last, ways to reduce depression is learn to curb negative thinking. It's inevitable for us to think negatively, pero may iwasan din niya. We can train our mind to to stop thinking negatively uh, when we, for example, when we identify or naramdaman mo siya, when we feel that we are now very negative na. It's like, pwede kayo mag-meditate, sulat niyo yung nasa isip niyo, and think of a positive thought. Don't jump to conclusion or be more creative. So maraming ways, no? Maraming ways. So for children, for school-age children, you can always talk to your parents, no? And to your teachers. And lastly, yan, ways to reduce anxiety and depression in relation to my previous slide is improve your sleep. So get up at the same day every day, get 15 to 30 minutes of sunlight every morning, and do relaxing activities. Use your bedroom for, I'm sorry students, hindi ko siya na, please erase po to, pang adult to. For sleep lang, no? For sleep lang, erase to nandito. Hindi ko nalagyan ng ano. Avoid screen light, caffeine, or alcohol before bed. Ayan. So those are the activities that you should follow, no, to reduce anxiety and depression kasi talagang talamak yung depression and anxiety ngayon. All right? So again, my dear audience and students, always remember that in some way or another, you're somebody's angel, even if you don't know it. So they love you and think of you, even if you don't hear it every day. Trust that there is love of all around you, even if you cannot feel it. So you are not alone. So always tell this to yourself every time that you feel anxious or depressed or lonely, that whatever challenges that you're currently facing right now, that's only part of the process. No? That's not the end. And one way to recover is to embrace, no? To embrace it. No? Marami akong gagawin. Okay lang yan. Maraming sinabi sa teacher, okay lang yan, gagawin ko, tatapusin ko yan. So just embrace that. And always remind yourself that you are not alone. Okay? So that will be all. So thank you for listening in
Thank you,
my short
sir.
webinar. Okay, so if you have questions, you can ask questions.
Okay,
Thank you.
thank you so much, Sir KR, for that very informative talk. We actually learned so much on how we can improve our physical as well as mental health. Indeed, sabi nyo nga po earlier, rest is just as important as work. So let us not be guilty, teachers, to take time to breathe kahit sa mga parent natin once in a while. Rather, let us know how to balance work time and rest time, di ba po? Then, for our parents po and guardian, let us be reminded never to ignore the early signs and indications that our children may be experiencing anxiety. This is very important to avoid mental breakdown, particularly among young children, since medyo prone po talaga sila dito now that we are in pandemic at hindi sila masyadong nakakalabas to meet their friends and enjoy. Tama po, sir. Okay po, sige. Before we proceed with the awarding of certificates, I'd like to take this opportunity to ask our participants for questions and clarification regarding the topic presented by Sir KR. Meron po ba tayong questions or clarifications po coming from our participants, teachers, parents, students? Okay, so I guess none. Thank you so much po. Then, to award the certificate of recognition to our resource speaker, I'd like to request Miss Dunisa Haina Magbanwa, our WINS coordinator.
Okay, sir. Thank you, sir, for the informative discussion and sharing your expertise And to award the certificate, let me read the citation. Department of Education, Schools Division Office, Manila, Margarita Rojas de Ayala Elementary School, A. Francisco Corner Arellano Street, Santa Ana, Manila. Certificate of recognition is presented to Kerpasel Litoriano in grateful recognition for his invaluable service as resource speaker during the virtual webinar on mental health, psychosocial support, and healthy lifestyle amidst pandemic, and for his outstanding contributions to the success of Brigada Eskwela 2021 Bayanihan para sa Paaralan, given this 13th day of October 2021 at Margarita Rojas de Ayala Elementary School, Santa Ana, Manila. Signed, Ma'am Abigail A. Banigon, Brigada Chairperson, our Master Teacher in Charge, Ma'am Lea de Iscaño, and Rosemary B. Ponce, our school principal. Thank you, sir, and congratulations.
Thank you
Thank you
so
very
much,
much po.
sir.
Thank you.
Okay, so once again, sir, thank you so much po. We hope to see you again in the future webinars that we will be
Yeah.
conducting po.
Yes, thank you.
Sana po
Thank
this
you.
is not
Thank
the
you, Ma'am
last.
Roseanne. Actually,
Okay.
malapit lang po pala kayo dito sa I'm currently residing here in Lamayan, kaya malapit lang pala 'tong kayo yung school
Oh,
niyo sa amin.
noted, sir, noted.
Thank you very much po.
Okay po. So, at this juncture, let us request once again Mrs. Abigail Banigon to introduce our next set of speakers. Ma'am Abby?
Yes. Again, Sir Kerfersel, thank you so much.
Okay, thank you po, Ma'am Abigail. Pwede na po ba log out po?
Yes po, sir.
Thank you.
Thank
Thank you.
you.
Thank you to all the dear students and to the teachers in the school. Thank you po.
Okay. So, our second resource speaker is a graduate of Pamantasan ng Lungsod ng Maynila in 2011 with a degree Bachelor in Secondary Education major in Filipino. Before entering the teaching field, he worked as an event host and singer for 2 years, a telemarketing officer for 3 years, and a customer relations specialist and technical support for 3 years. He won several awards in singing. To include a few, he finished top 6 out of 64 contestants in YMCA The Voice Singing Contest in 2019 and second place vocal solo advisor during the 30th Annual Youth and Congress Advisors. Participants, I am proud to present to you our resource speaker for the topic Promoting Digital Well-Being, one of the prides of grade 3 teachers, Mr. Isabelo Binala Jr.
Hello po, good afternoon everyone. Miss Roseanne, mag-represent po ako.
Okay po,
Sir,
sir.
Sir Isabelo,
Yes po.
introduce ko na rin po yung third speaker natin para diretso na po yung flow natin.
Sige po.
Okay. And our third resource speaker is a registered nurse. He had served as healthcare volunteer for 1 year in Bacolod City, as private nurse for 4 years in Malaysia, and as a project nurse for 3 years at YU Company before he took up his professional teaching certificate at the Technological University of the Philippines. He passed the licensure examination for teachers in 2016 and joined Margarita Rojas de Ayala Elementary School in 2017. And again, ladies and gentlemen, our resource speaker to talk about mental health and psychosocial support is none other than our very own DRRM coordinator and grade 3 teacher, Mr. Gilbert Mendoza. Take it away, Sir Bello.
Yes po. Nakikita na po yung presentation ko. I think hindi pa po kasi
Yes,
nag-present
sir.
pa si Ma'am Aina. Nandiyan na po?
Yes, sir. Motivational
Okay,
speech.
sige po. Before I proceed to my topic, I just want to show you a video, okay? Naririnig po, Miss Roseanne? Naririnig po
Yes,
ba?
sir. Yes, sir.
Okay, thank you
Medyo
po.
mahina lang, sir.
Hello? Hindi po siya clear. Yung sound po hindi clear.
Hindi po hindi masyado marinig, ma'am. Sir Bello.
Masyado marinig. Okay. I think po lahat naman po ay napanood at narinig po yung video. Pasensya po dun sa mga di gaanong nakarinig ng video. So, this video, I showed this video because I know that this video is really, really matter to us right now. Because what we experienced about 1 year ago until now is still depressing, but we're still fighting. The fact that we are still kicking and living in the testimony of God, we are blessed. Like what video showed. Diba? Agree naman kayo doon, di ba, na itong video na to is papakita na yung depression na meron tayo ngayon, all of us experience anxiety. Di ba? Lahat tayo naka-experience ng anxiety. We came to the point na gigising tayo na minsan because of COVID-19. Diba itong COVID-19 na to is grabe, talagang pinabagsak tayo. Maraming pinabagsak itong COVID-19. Me, personally ako, every time na magigising ako, I felt na may fever ako, na may masakit yung ulo ko kasi ano na siya kumbaga nandun na siya sa sistema ko. But I see to it na nilabanan ko siya. So ganun din yon. So etong topic na aking tatalakayin ngayon ay malaki ang maitutulong sa ating lahat, especially sa ating mga guro at sa ating mga estudyante. Ayan. So let me share again my screen. Wait po. Yan. Po. Wait lang po Ayan. So my topic is all about mental health. So before we proceed, kanina nasabi na rin ni Sir yung speaker natin, yung definition ng mental health. So mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Tama nga yung definition nito, di ba? Itong mental health, lahat tayo is kailangan na pangalagaan natin ang ating mental health because it's really important for us to monitor our mental health. 'Di ba? Hindi lang yung ating physical aspect, 'di ba? Hindi lang yung ating spiritual, 'di ba? Kumbaga, yung mentalidad kasi dito sa ating mentalidad, ito yung nagbibigay sa atin ng tamang pag-iisip kung ano ba yung magiging decision natin, kung magiging decisive ba tayo dun sa mga gagawin natin, 'di ba? Kung ano ba yung patutunguhan natin. 'Di ba? Pero minsan wala namang perpektong tao, but at the same time, we tend to think depth, 'di ba? Nag-iisip tayo ng malalim para mas maging maganda yung manifestation ng ating gagawing plano. Kasi at the end of the day, ang mangyayari naman yan ay sa atin pa rin magkakaroon ng feedback at doon sa mga tao na nakapaligid sa atin. Ayan. So, syempre, ang mental health, meron po itong tinatawag natin na mga negative effects, di ba? Ibig sabihin, ano nga ba yung mga nakakaapekto sa mental health ng isang tao? Bakit siya nag-a-arrive sa ganoon? Bakit nagkakaroon ng ganoong thinking ang isang tao? Di ba? Let's see. Yan. What are the negative effects of mental health? Ayan. So, lagi nating iniisip, kapag sinabing, when we are talking about mental health, it's all about the aspect of health or mental. Diba? Yung mentalidad ng tao. Pero iniisip din natin, alam niyo po ba na ang mental health ay apektado po lahat yan. Physical aspect, spiritual aspect, ayan. Lahat yan apektado. Kasi itong mental health natin is kailangan ito ay mag-function ng normal. Diba? Kung magka-function ito ng normal, magiging maganda ang epekto nito sa atin, hindi lang sa atin, at pati doon sa mga nakasurround sa atin. Diba? So, tignan natin yung mga negative effects of mental health. Tignan natin. Ayan. So, these are the negative effects of mental health. Una, yung complications. Siyempre, diyan na nagkakaroon ng komplikasyon. Di ba? Lahat tayo nakaranas niyan. Di ba? Everyone experiencing this kind of situation. Di ba? Nagkaroon tayo lahat ng komplikasyon. Di ba? Sa pamilya natin, sa kaibigan natin. Minsan kapag stress tayo, di ba? We tend to, minsan hindi na natin alam yung gawin. Minsan nag-i-stress eating. Ako, personally, nung ako ay nai-stress, ako ay nag-i-stress eating. Yun yung ang tawag nila. Sabi nga nila, Sir Belo, parang tumaba ka, sabi ko, kasi po nai-stress ako. So minsan, yun pala ay nagkakaroon ng negative effect, 'di ba, sa akin. Although, yun ay napapasaya ako, nabibigyan ako ng pleasure, pero at the same time, hindi rin pala yun healthy. Yun. So, unhappiness and decrease. Ayan. Etong unhappiness and decrease, nangyayari din ito sa atin. Halimbawa na lang, kapag tayo ay merong isang bagay na ginagawa. Katulad ko dati, ako ay, nung ako ay mahilig akong kumanta, nagkaroon ako ng, dumating ako sa punto na nawalan ako ng appetite. Nawala yung gana ko sa pagkanta. Kasi nga, naging overthinking ako. Ang dami kong iniisip. So minsan, hindi ko na nabibigyan ng attention kung ano yung strength ko na meron ako as a person. 'Di ba? Yung enjoyment of life, hindi ko na nagagawa yun nung una. Siyempre, minsan, nagagawa mo yun, pero pagkatapos nun, balik ka na naman sa normal. 'Di ba? Nagkakaroon ako ng anxiety. Ayan. So, family conflicts, ayan, napagdaanan ko yung family conflicts, up and downs, lahat yan napagdaanan ko. Siguro, everyone naman could relate with me na lahat tayo nagkaroon ng family problems, di ba? Pag nagkakaroon tayo ng family problems, ang tendency, mas nagsisik tayo ng attention dun sa mga hindi natin biological member of the family, di ba? Kasi minsan doon tayo nag-vent out. Ibig sabihin, doon natin nilalabas yung emosyon natin. Doon tayo nagiging self-expressive, di ba? Doon tayo nagkakaroon na, pare, alam mo ba, friend, ganun, di ba? Doon tayo nag-vent out. Kumbaga, sila yung naging walking diary natin. Pero at the end of the day, what I learned is family is still the foundation of everything. Kasi yung pamilya mo, ako, nagkaroon din ako ng nagkaroon ako ng pagkakataon na nagkaroon ako ng tampo sa pamilya ko, di ba? For about 1 year. Pero at the end of the day, nagrepent ako. Inisip ko rin yung naging pagkukulang ko as an individual, as a person to them. At ganun din sila. Kumbaga, nagkaroon kami ng exchange of thoughts when it comes to our sins. So, importante din yon. Nakausapin natin yung pamilya natin, di ba? Kasi sila yung magiging pundasyon natin. Whatever happens to us, still, family is a family. Yan. Relationship difficulties, ayan, kasama din dyan yung pamilya, pwede rin yung kaibigan. Sometimes, ginajudge tayo ng mga tao di ba? Minsan pag ginajudge tayo ng tao, it's either nagkakaroon tayo ng kinikriticize nila tayo. We call it a constructive criticism, di ba? Kinikriticize na tayo kung anong ginagawa natin. Pero hindi nila alam minsan kung ano yung pinanggagalingan natin. Diba? Pero at the end of the day, what really matters is we still stand up. Diba? Yun yung mahalaga. Ayan. Minsan social isolation. Ayan, minsan, Actually, nagkaroon ako ng ganyan sa mga estudyante ko. Hindi ko na lang i-mention kung sino yon. Meron akong estudyante na hindi talaga siya nakikisalimuha sa mga classmates niya. Why? Isa sa mga naging rason is kasi inaasar po siya. Binubuli siya, which is maling-mali, di ba? Alam naman natin na kapag sa classroom, importante ang social interaction, di ba? Kailangan nating makipag-usap para matuto rin tayo, di ba? Importante 'yon para nahasa din yung confident ng mga bata, di ba? Kapag recite, di ba? Kumbaga yung unity, nagkakaroon ng development, di ba? So really important to us, hindi lang sa atin, kumbaga sa ating mga learners, na mabigyan natin sila ng pagkakataon na makilalang isa't isa, lalo na kapag meron na tayong face-to-face, di ba? Kasi ngayong online class, parang very rare mangyari yun na makilala nilang isa't isa. Kasi iba pa rin talaga kapag face-to-face na nag-uusap yung mga bata kasi they tend to learn each other, di ba? Ayan. So, problems with tobacco. So, wala naman tayong mga ganyan sa mga bata natin. So, ayan. Work on school, ayan, legal and financial problems, and poverty and homelessness, ayan. So, ayan, syempre, financially, lahat naman tayo nagkakaproblema niyan, lalo na last year, when pandemic arrived, di ba, lahat na apektuhan, di ba, my sisters was the one who affected with that pandemic. Kasi yung kapatid ko dapat ay pupunta na yon ng made-designate na siya sa Cagayan de Oro and Iligan City sa Mindanao. Doon sila dapat mag-work. But unfortunately, it didn't happen kasi nga dahil nga dito sa pandemic na ito. So it affects their industry. It affects their income, 'di ba? So meaning to say, etong pandemya na ito ay talaga naging malaki ang anxiety. Yung naging malaki yung epekto nito, 'di ba? Nagkaroon ng depression, anxiety. Yung kapatid ko nga actually yung ate ko is isa sa aking tinitingala. Yung kapatid kong 'yon kasi siya yung panganay namin. Although nagkaroon kami ng problema, pero yung ate ko kasi when I was a child, siya talaga yung nagpaaral sa akin. So until now, nilook up ko pa rin siya. Every time na nag-uusap kami at nakikita ko yung post niya sa Facebook minsan, alam ko na may pinagdadaanan yung kapatid ko. At syempre, ang isa sa mga naging apektado siya dahil nga yung trabaho niya ay naapektuhan. So hindi lang naman siya, marami sa atin ang naapektuhan, di ba? Kaya nga nagkaroon ng programang ating government na magbibigay ng ayuda. Di ba? But not everyone naman is naka-receive ng ayuda na yun. At minsan, kulang pa nga, di ba po? So yun. So ibig sabihin, ito yung negative effects nito sa ng mental health. Di ba? Maraming epekto na negatibo kapag itong mental health natin ay napasukan ng mga di magandang sitwasyon. Di ba? But what really matters right now is we still kicking and living with the testimony of God. Ayan, syempre kung may negative, meron din tayong positive, di ba? Meron din positive effect ang mental health. Ito, tingnan natin. Dali lang po Medyo mabagal po. Wait lang po. Ayan. Good mental health and well-being. Yan, importante na meron tayong good mental health. Kasi importante ito. Kailangan maging infectious tayo doon sa mga tao. Paano tayo magiging infectious? In a positive way. Kailangan makahawa tayo ng good vibes doon sa mga tao. Minsan kasi, di ba, tayo minsan, kahit may pinagdadaanan na tayong malalim sa buhay, we tend to be happy, we tend to be infectious to those who are really needs, di ba? Ako mismo, syempre may problema din ako minsan, lahat naman tayo, pero minsan gusto din natin maka-inspire din sa ibang tao. Nag-a-arrive tayo sa ganong sitwasyon kasi ayaw din natin na maging nega sila sa atin, di ba? Lalo na yung mga sa pamilya, di ba minsan yung mga nanay at tatay natin, Di ba mga parents, kung may mga parents po dyan, lahat naman siguro, di ba, hindi natin pinapakita sa mga anak natin yung kahinaan natin. Kasi gusto natin makita nila na tayo ay malakas. And we want that aspect that our child will have that, di ba? Gusto natin na magkaroon din ng ganyang attitude. Ayan. So, tingnan natin ano mga good mental health and well-being. Ayan. Una, ang a good mental health is learn to relax and do things you enjoy. Ayan. 'Di ba? Kailangan meron tayong mga bagay na yung gustong-gusto nating gawin ay i-enhance natin, 'di ba? Gawin natin ng mahusay, 'di ba? Ano-ano ba yung mga 'yon? Halimbawa, yung spending quality time with your friends, 'di ba? So minsan, kailangan makipag-usap tayo sa mga kaibigan natin, importante yung salitang kumusta. Bakit po importante yung salitang kumusta? Kasi kahit papaano, ito yung nagbibigay sa atin ng relief. Di ba? Ito yung nagbibigay sa atin ng mensahe na we need to be positive despite of all negative things or shortcomings that arrive in our lives. Di ba? Kasi kapag kinakumusta mo yung isang tao, ay, sasabihin mo, ay, salamat naman, may kaibigan pa ako. Di ba? Salamat naman at kinakamusta niya ako. 'Di ba? We should have a circle of friends, 'di ba? Lahat tayo may ganon. May ganon tayong mga bagay. Meron tayong circle of friends wherein doon tayo nag-vent out ng ating emotion. 'Di ba? Doon tayo naglalabas na ating saloobin, negative man ito o positive. Pero importante na meron po tayong kaibigan kasi sila po yung tutulong sa atin. Hindi man nila tayo matulungan ng malaki pero kahit papaano, maibsan kung ano yung nararamdaman natin. 'Di ba? Minsan ako, pag gusto ko mag-enjoy, nanonood ako ng Netflix. Siyempre, maraming nakaka-relate siya, nanonood ng Netflix. 'Di ba? So, isa sa mga pinanood ko doon sa Netflix at na-inspire ako yung Miracle.
Sir Bello,
Kung
wala po yung audio.
Nawala po? Narinig nga po? Okay na po?
Meron po, meron.
Meron naman. Okay po. Di ba yung Netflix? Ito yung minsan sa akin nagpaparelax. Minsan nanonood ako isa sa pinanood ko yung Miracle. Yun yung parang bata na may sakit siya na parang yung nanay niya hindi talaga siya sinukuan. Di ba? So yung nanay niya, ang ginawa ay talagang lahat ng paraan ginawa niya. Pumunta siya sa mga doktor. Yung pananalig niya sa Panginoon hindi nawala. Nandun yung faith. So sometimes, we need to watch like that. Di ba? Yung mga bagay na nagbibigay sa atin ng inspirasyon para ma-uplift yung spirit natin as an individual. And we as an individual, pwede natin yun ma-impart doon sa mga kamag-anak natin. Sabihin, panoorin mo to, huwag kang mawawalan ng pag-asa. Napakaganda ng istorya niyan. Very uplifting. Promise, hindi ako mapapaya sa iyo. Napakaganda. Full of substance. Napakaganda. Hindi ka mapapaya. Kasi, why? Kasi nagbigay ka ng isang inspirational story doon sa iyong kakilala. And that really matters for me. Ayan. Tapos, get moving. Ayan, so moving. Minsan galaw-galaw tayo, mag-exercise tayo. So, isa sa mga inspiration ko sa Get Moving si Miss Rose Ann. Kasi si Ma'am Rose Ann, lagi ko pong nakikita na nag-exercise yan doon sa Circuit Makati pero hindi ko magawa. Si Miss Rose Ann, tapos si Ma'am Marie naman, mahilig yan mag-Zumba. Every time na may program tayo, si Ma'am Marie nagvo-volunteer na mag-Zumba kasi alam niya na makakatulong siya. So, let's move, let's kick, 'di ba? So, sabi nga galaw-galaw baka ma-stroke ka. 'Yun yung sabi nila, 'di ba? So, we need to move sometimes our body para naman ma-stretch natin, 'di ba? Ma-stretch natin yung katawan natin. Minsan mahirap talaga yung gawin lalo na kapag wala ka sa wisyo para gawin 'yon. Pero at the end of the day, it's really important pala na mag-exercise tayo. Ayan. So, eat healthy. Ayan. So, kailangan natin kumain ng masustansyang pagkain. Lalo na itong mga bata na to ngayon. Kayo mga learners, importante na kumain kayo ng masusustansyang pagkain. Bakit importante? Alam niyo po, sa panahon ngayon, sabi nga ng sa aking napanood ay sabi ng doktor, importante na mas madaming gulay at prutas na kinakain ang mga bata, di ba? Kaysa sa mga karne. Diba? Kasi alam naman natin na yung karne is sometimes or nagdudulot talaga siya ng high cholesterol, di ba? So kailangan nating maggulay at magprutas sa yung mga greeny vegetables kasi ito yung nagbibigay sa atin ng sustansya, di ba? Ito yung kailangan ng ating katawan lalo ng ating puso, di ba? Ayan. So get enough sleep. Okay, may tanong ako sa get enough sleep. Gusto kong tanungin si Ma'am Rose Ann. Ma'am Rose Ann, ikaw po ba kung tatanungin kita, sa tingin mo ba na-achieve mo ba po ba itong get enough sleep?
Yes, sir. Yes na yes,
Paano
sir.
paano mo po siya
Very
na-a-achieve? Puwede mo po
particular
bang
ako sa
i-share?
aking very particular ako sa aking rest time, sa aking sleep time. By 8, talagang I see to eat na nagre-ready na ako for bed. Alam po yan ng mga friends ko. Pero lately, pagka may time at nakakapag-jog ako sa gabi, medyo nagiging mas late yung aking sleep. Pero pinaka-late ko na is 10 p.m. Talagang
10
yun ang oras
PM.
ng akin. Yes po.
Yan. Kasi ako before, yung body clock ko kasi, nasanay ako na nag-work kasi ako sa BPO industry. So, ibig sabihin, yung aking pasok ay panggabi. So, yung pasok ko ay flexible. Ibig sabihin, nasa management nakadepende yung oras ko. So, ang pasok ko noon, nung ako ay nasa panggabi pa, ay alauna ng hapon hanggang 10:00 ng gabi. Minsan, 2:00 ng madaling araw hanggang 2:00 ng hapon. So, minsan nag-e-extend kami kasi kailangan ng maraming workforce. So, ako, nung panahon na yon, sobrang na-stress na din ako. Hindi ako na-stress sa trabaho ko, na-stress ako sa schedule ko kasi wala kaming definite time talaga. Kasi it depends on calling. Depende kung gaano kadami yung kailangan ng management. So, nung lumipat ako ng Margarita, Roas de Ayala, so nagbago yung body clock ko. So, 'di ba? Ang una kong schedule niyon ay naging pang-umaga ako, naging panghapon ako. So, nung kinausap ko si doktor, nagulat ako, bakit ako naging high blood? So, sabi ni doktor, kaya daw ako naging high blood, although yung kasi ako, alam nila yan ng mga kaibigan ko dito na mahilig ako sa gulay. Very minimal ako kumain ng karne. Kumakain ako ng karne, pero mas preferred ko talaga ang gulay. Sabi, isa daw sa naging rason kaya ako naging high blood o tumaas yung BP ko ay yung body clock ko. Nagbago. Kasi nga, from that time na yung pasok ko, kumbaga tawagan nila sa amin ay mga zombie kasi matutulog kami umaga. Kasi alam niyo naman ang work ng call center. 'Di ba? Alam niyo yung mga trabaho ng mga sa BPO ganun. So, kumbaga, during that time, na-realize ko na until now, na-apply ko pa rin siya. Minsan napupuyat pa rin ako kasi parang nandun na siya sa sistema ng katawan ko. So, minsan iniisip ko paano ko kaya ito matatanggal. Gusto kong matulog. Sometimes kung uminom ako ng Benadryl, tinry kong uminom Benadryl kasi sabi nila effective daw yon pampatulog minsan. So, parang di naman umepekto sa akin. So, lahat ng sleeping pills tinry ko. So, parang bahagi na siya ng body system ko. So, minsan ako pag nasa bed na, so syempre browse ng browse hindi makatulog. So, ang tendency, hindi talaga ako nakatulog ng maaga. Very rare na makatulog ako ng maaga. Pero nung nag-work po ako sa call center, sa BPO industry, whether you believe it or not, ako po ay nakakatulog ng 12 to 16 hours. Yun po yung natutulog. Minsan, nangyayari po yun kapag yung, kasi po meron akong off minsan na Friday, Saturday, Sunday. Nangyayari po yun sa akin. Kasi meron po kaming off, yung tinatawag naming, yung parang, yung leave namin. Pwede namin yung i-leave. So ako, nakakatulog ako ng ganoon. Minsan pala, hindi rin pala healthy yon. Kasi, yung body system natin is nagbabago. Yung circulation ng dugo natin ay hindi nagiging normal. Ayan po. So, stay connected and keep in touch with families and friends. Ayan. So, ito, alam naman natin is very, very now. Kasi lahat ito ay nangyayari ngayon, 'di ba? Lahat tayo lalo na ngayong quarantine, 'di ba? Nung nagkaroon ng puro lockdown, ECQ, MECQ, GCQ, Pasko, joke lang. 'Di ba? So nagkaroon ng gano'n, so mas naging attached tayo sa pamilya natin, 'di ba? Minsan nga sabi nga nung kapatid ko, "Ano ba 'yan, tayo-tayo na lang na naman. Lockdown na naman, tayo na naman magkakasama." So minsan nagkakaroon ng sawaan factor. Minsan pala may ganoon ding pero mas nakikilala natin yung pamilya natin, 'di ba? Nadi-discover natin, o halimbawa ako na lang, na-discover ko na magluto, natututo ako magluto, gano'n din yung sa ate ko, nakikita ko siya kung paano magluto. Kumbaga, nai-engage mo yung sarili mo doon sa pamilya mo, 'di ba? Mas nagiging purposeful yung ginagawa mo as an individual kahit na hindi kayo lumalabas ng bahay. Ayan, sabi nga ni Kim Chu, bawal lumabas. Ayan. So get involved. Itong get involved, napakalaki ng naging epekto nito sa akin. Kasi last October, October tama. Last October is bumalik ako sa simbahan. Nag-serve ako ulit kay God. Sabi ko kasi, God, allow me to serve again to you. So nag-serve ako kay God, sumali ako sa choir ng simbahan namin sa Cavite. Ayun, pinalad naman ako at naging get involved ako at parang doon ko ulit na-uplift yung spirit ko as a Roman Catholic. 'Di ba? Kasi kapag tayo ay kumakanta sa ating Panginoon o inaalay natin lahat ng nangyayari sa buhay natin sa Panginoon, mas nagiging purposeful yung meaning na ginagawa natin o yung buhay natin mismo. 'Di ba? Na-uplift yung spirit natin. So yun yung isa sa pinaka naging magandang experience ko last year. Ikaw ba, Miss Avi, if I may ask, saan ka ba naging get involved during the pandemic? Miss Abigail? Ma'am Avi, nandiyan ka po ba?
Sir, yes po, dito po.
Ayan.
Ako sir, good thing na mommy na ako. So, ako
Alam
talaga,
ko yan.
yes, focus ko talaga yung itong buong pandemic na asikasuhin sila.
Nakikita ko
Yung
nga.
laruin sila, yung ganun, sir. Okay, sir,
Ayan.
since natawag mo na rin ako, no, sorry to interrupt you po, pero tumawag po sa akin ang chairman niyo po. Parang may kailangan daw po ata kayong i-open para sa religion class. Sorry po, sir.
Okay, sige po. Wait lang po. Kasi ako po ang doon.
Yes po. Sorry po sa
Sige po, wait.
interruption.
Okay, so while waiting po kay Sir Bello, siguro we can take this opportunity na mag-merienda to have our snacks or short break. 5 minutes ba break? Habang hinihintay po natin si Sir Bello. May inaayos siya.
Okay na po ako.
Okay
na
na
po
po,
ba?
sir. Ang bilis lang pala. Okay po, sir. Take it away.
Okay po. So, yun po, sabi nga ni Miss Abby kanina na share niya na get involved, dun sa get involved, na talagang she makes sure na meron siyang bonding time dun sa kanyang mga anak since siya nga ay mother of two na. Ayan. So, lahat tayo may ganyan naman talagang experience, di ba? Ako rin, ganun din sa mga pamangkin ko, I see to it na experience ko din yung pagiging bata nila. Kasi minsan, we need to put our shoes to them. Diba? Parang maranasan natin kung ano din yung naranasan nila. Kumbaga nagkakaroon kayo ng engagement. Ayan. So, next is yung problem solving. Yan. Importante din yung, di ba yun sa problem solving, minsan dyan nag-a-arrive yung iisipin mo na yung parang, paano ko ba to mariresolve ba? Ano bang gagawin ko na naman? Parang iniisip mo na agad yung pinapakomplikado mo yung problema imbis na mag-isip ka ng magandang resolution. Sabi nila, isa sa pinakamagandang gawin para ma-resolve ang isang problema ay magkaroon ka ng action plan. 'Di ba? Minsan, kailangan mo rin mag-seek ng advice doon sa mga taong pinagkakatiwalaan mo para magkaroon ng resolution ng isang problema. Ayan, syempre, kailangan din natin mag-set ng goals, 'di ba? So kailangan kapag meron tayong gagawin, meron tayong set of goals. Meron tayong goal for that particular day. Ano ba yung kailangan nating gawin? Ano ba yung gusto nating mangyari? Ano ba yung gusto nating maging feedback neto, not only to us, pero doon din sa mga taong nakasurround sa atin. 'Di ba? Importante 'yon na magkaroon tayo ng set goals kasi at the end of the day, hindi naman tayo gumagawa ng isang bagay na walang patutunguhan, 'di ba? Kailangan ito ay may patutunguhan para katulad nga ng sinabi ko, maging purposeful at maging productive tayo doon sa mga gagawin natin. At the same time, yung magiging manifestation din naman nito ay para din sa improvement, hindi lang para sa iyo at doon din sa mga tao na bibigyan mo ng information regarding doon sa goals na gusto mong mangyari or doon sa gusto mong patunguhan ng particular na project. Yan. Number 9, consult with mental health expert if needed. Yan. Last year, ako rin, hindi ko sinasabi na na meron akong problema sa pag-iisip. So, nag-seek din ako ng ganyan. Kailangan daw kasi minsan, kapag masyado na tayong overthinking, nagsisik tayo ng attention o nangingi tayo ng advice dun sa mga mental expert. Kasi para malaman natin kung ano na ba talaga yung status ng ating mental health. Importante po yun. Kung di na talaga kaya, kailangan natin. Kasi sometimes kasi, ang magiging advice nila sa atin, dapat iwasan mo to. You need to avoid this kind of thing. You need to do this kind of thing. You need to change something. 'Di ba? So may mga ganong senaryo na it will really, really matters to us na pwede rin nating i-impart doon sa mga tao na malay natin na gano'n din yung nagiging experience nila. At the same time, makakatulong din tayo. 'Di ba? So, importante po yun na kailangan meron tayong, kapag di na talaga natin kaya, kapag baon na tayo sa problema, minsan kung di na kaya ng sa family, pwede tayong humingi ng expertise from mental health expert. 'Di ba? So, yun po. So, right now kasi, tayo rin ay nasa new era na eh. 'Di ba? Sabi nga nila, tayo ay nasa mundo na ng Gen Z. Ako, kung tatanungin ako, feeling ko hindi ako Gen Z. Kasi ako old school ako eh. Hindi ako ganun hindi ako ka very now. Old school pa rin ako eh. When it comes to music, very old school ako. When it comes to dancing, old school ako. Ngayon kasi iba na. 'Di ba? Napakabilis na ng pagbabago. 'Di ba? Yung pacing na nangyayari is napakabilis. So ngayon, tingnan natin ano nga ba yung epekto ng digital world sa atin. Okay? Yan. Promoting digital well-being. So paano ba natin mapopromote yung digital well-being? Ayan. Ano ba nga yung mga dapat natin isaalang-alang para magkaroon tayo ng well-being when it comes to digital world? Diba? Let's see. Sabi dito, Digital well-being is a term used to describe the impact that technologies and digital services have on our physical, mental, and emotional well-being. On an individual level, it is the state of personal well-being one experiences through the use of electronic tools, systems, devices, and resources. So, alam naman natin ngayon na napaka-powerful na ng mundo when it comes to technology aspect. Lalo na ang social media. Di ba? Ito ay napaka-powerful at the same time napaka-fearful. Di ba? Makapangyarihan pero nakakatakot. Bakit nakakatakot din? Kasi hindi mo rin alam kung ano yung magiging epekto nito, 'di ba? Lalo na ngayon sa mga bata, 'di ba? Nagkakaroon sila ng access eh. Nakikita nila yung dapat hindi pa nila maranasan, pero nararanasan nila. Wala man sila dun sa actual na nangyayari, pero nakikita nila. Minsan kinukwento na nila yung sa magulang nila, minsan nga advance na sila mag-isip sa mga magulang nila. Nay, ganito pala 'yon. Yung alam mo 'yun, dapat mga naka-rated SPG na dapat hindi nila malaman pero nalalaman na nila. Kasi nga, very accessible na ngayon, 'di ba? Dahil sa nangyari, napaka-massive. 'Di ba? Ibig sabihin, napakalakas ng social media right now. So, tingnan natin kung ano nga ba yung mga paraan para kahit papaano is magkaroon tayo ng digital well-being. Okay? Yan. Take a look at your digital habits. So, kailangan daw nating i-check yung ating digital habits. Yan. Ano ba yung ginagawa natin para sa ating digital habits, di ba? Sabi, kailangan tayo mag-create ng mga bagay na alam natin na nakakatulong sa ating digital habits. Halimbawa, ako, ang ginagawa ko minsan, may pina-follow ako sa Facebook, yung kasi mahilig din ako magluto. So, ang pina-follow ko si Chef RV. So, kilala niyo siguro si Chef RV. Ayan, chine-check ko si Chef RV para kahit pa paano mawala yung stress ko. The same time, kapag pinapanood ko siya, natututo ako at nai-inspired ako doon sa kanyang mga ginagawa. Isa pa, mahilig din ako sa singing contest. So, minsan, pinapanood ko yung The Voice USA. So, pinapanood ko yon para kahit papaano mawala din yung stress ko. So, kailangan i-check din natin yung digital habits natin kung ito bang fina-follow natin is nagiging maganda ba yung epekto sa atin as a person? Nagiging maganda ba yung epekto nito doon din sa mga kasama natin sa bahay? 'Di ba? Sabi nga nila, we cannot please everyone. So, sometimes, kailangan natin maging careful din tayo kung tayo ay pipili o manonood ng isang gusto talaga natin. Katulad ko, yung The Voice, pinapanood ko yan, tsaka si Chef RB. Sino po ba dito ang mahilig din manood ng mga vlog? Sino kaya pwede ko tanungin? Alam ko na po. Si Ma'am Aina po kasi, kadalasan po kasi nakikita ko siya nagti-TikTok. Miss Aina, Ma'am Aina Maritan, ano ba yung nadudulot sa iyo ng TikTok? Ma'am Aina, nandiyan ka po ba?
Yes, sir. Ano po yun ulit? Sorry.
Ano yung naidudulot sa yung maganda ng TikTok? Kasi lagi kita nakikita nagti-TikTok.
Ikaw talaga. Actually, yung TikTok naman kasi is pag wala lang akong maisip na gawin o kaya pag may gusto kong nagbabrowse lang ako para lang libangan ko lang siya. And it's took parang a minute lang naman para makagawa ng isang TikTok. Thank you.
Ayan, tama, no? Siyempre, alam naman natin na isa yan sa mga ngayong kung saan nag-i-engage yung mga bata sa TikTok, di ba? Kahit tayong mga matatanda, adult, is nagti-TikTok din. Kasi kahit pa paano, nare-relieve yung ating nararanasang stress, di ba? Ayan. Monitor your digital activity. Ayan. Ako, kailangan i-monitor din daw natin yung ating digital activity. Di ba? From time to time, tayo minsan, sige, Queenie, nagre-raise ka ba ng hand mo? May tanong ka ba?
Yung sa TikTok po, nawawala
Okay,
po yung pagiging pagkamahiyain ko po kapag gumagawa po ako ng
Ayan.
video.
Tama. Kumbaga, nabuboost yung confident mo, no? naa-afflict yung spirit mo nito, 'di ba? Kahit papaano sa TikTok, ako nga hindi rin ako marunong sumayaw eh. Pero hindi pa rin talaga ako nagti-TikTok. Pero yung nakikita ko yung iba kahit hindi marunong sumayaw, nagti-TikTok sila kasi yung in ngayon. At the same time, hindi naman masama mag-TikTok. Lalo na sa mga kabataan ngayon, ito yung isa sa pinakamagandang social media platform na ginagamit ninyo, lalo na kayo mga kabataan ngayon, para kahit papaano, mawala yung stress nyo, maboost yung confident. Tama yun, Queenie, no? So, tama yung sinasabi mo na kahit papaano is nare-relieve yung stress mo. Katulad ni Ma'am Aina. Ayan, si Ma'am Aina nga, minsan ginagaya pa yung mga actresses. So, si Ma'am Aina, minsan nakikita ko yung kanyang pagdadab. With matching attitude ba yon? Pero, in a positive way. Ayan. Next is monitor your digital activity. So, kailangan natin minomonitor din natin yung digital activity natin. 'Di ba? Kung ano ba yung ginagawa natin from time to time. Lagi ba tayo nakatutok sa cellphone? Lagi tayo nakatutok sa laptop? 'Di ba ganun tayo? Lalo na pag online class minsan, kapag online class na natin, syempre, tayo as a teacher, dire-diretso na yon, mag-check na tayo ng mga paperworks, mag-check na tayo ng mga ipapasa nila sa Google Classroom, 'di ba? Tingnan natin yung ginagawa natin from time to time. Meron pa tayong chat group ng mga parents, may mga concern. So minsan, hindi na natin siya na ma-manage ng tama. Pero ang pinakamagandang gawin para doon ay step by step yung gawin natin. Halimbawa, dito ka muna, tapusin mo muna itong pag-check dito sa iyong ginagawa sa Google Classroom. At the same time, kung kaya mong pagsabayin talaga lahat, do it. 'Di ba? Pero kung hindi mo talaga kayang pagsabayin, umisit ka ng plano na sa tingin mo na magiging epektibo at magkakaroon ka ng tinatawag nating time management. Yan. Set boundaries. Ayan. Siyempre, guilty ako dito sa set boundaries. Kasi kapag ako is nakatutok na rin minsan sa cellphone, hindi ko na rin napipigilan na nagsi-cellphone ako, lalo na pag mahilig ako manood ng mga video. Pero kailangan pa rin natin mag-set ng boundaries kasi importante yan na mag-set tayo ng boundaries kasi ito na yung time na kailangan natin ng, stop muna tayo dito. Mamaya na tayo. Alam niyo ba yung pubbing? Sino nakakaalam ng pubbing? Meron po ba nakakaalam ng pubbing? Wala, no? So ito share ko lang sa inyo. Yung pubbing, ibig sabihin po no, lalo na ngayong panahon na ito sa mga millennial, 'di ba? Halimbawa, nasa pagkainan tayong lahat. Kumakain tayong lahat. Siyempre normally lahat may cellphone. So, minsan katabi na natin yung natin, hindi tayo nag-uusap-usap. Wala tayong verbal communication. Kasi lahat tayo busy sa cellphone, yung isa nasa Facebook, yung isa nasa Twitter, 'di ba? Yung isa nasa YouTube. So, importante rin minsan na i-less natin 'yon, 'di ba? Yung naalala ko ang aking tita kapag kakain kami, sasabihin niya, talagang i-reprimand niya kami na no cellphone allowed. Bawal mag-cellphone kapag kumakain kasi yun yung time na magkakaroon kami ng communication. Doon kami mag-share ng thoughts, kung ano yung nangyari sa amin sa araw na ito, ano yung ginawa namin ngayong araw na ito, naging makabuluhan ba yung araw namin ngayong araw na ito. So, importante na mag-set tayo ng boundaries kasi importante po yun. 'Di ba? Halimbawa na lang, yung mga meron diyang, halimbawa, nasa jeep. 'Di ba? Nasa jeep din minsan. Minsan mag-jeep tayo, magkakatabi na tayo, lahat tayo busy sa cellphone. Kahit magkakilala tayo, hindi tayo nag-uusap. Kasi nga, busy tayo sa cellphone. Tawag doon pubbing. Ibig sabihin, hindi kayo nagkakaroon ng interaction or verbally, hindi kayo nag-uusap. Kasi nga, busy kayo sa pagsi-cellphone. 'Di ba? Ayan. So, bedtime curfew, parang kanina rin to, no? Bedtime curfew, importante yung bedtime curfew. Kasi, kailangan sa digital world, ngayon, ang gawin natin is kailangan magkaroon tayo ng limitation. Di ka, kapag tulog na, kapag oras ng tulog, matulog na tayo. Di ba? Wag na tayong masyadong mag-focus sa pagsi-cellphone. Pero alam naman natin, lahat yan ay hindi nakakagawa. Tama? At aminado ako, isa rin ako doon. So, kailangan pala isa sa mga para maging para mas maging epektibo yung pagtulog mo, huwag kang magse-cellphone. Naalala ko si Miss Cathy dati, si Ma'am Cathy dati, nag-share siya sa atin na kapag siya daw ay matutulog, ang ginagawa niya, Ma'am Cathy, tama ba ako? Ino-off mo yung light ng cellphone mo or pinapatay mo yung wifi, dini-disconnect mo. Tama ba ako? Miss Cathy, nandiyan ka po ba? Miss Cathy? Ma'am Cathy? Wala yata si Ma'am Cathy. Wala si Ma'am Cathy. Wala si Ma'am Cathy? O sige. Ayan. O, diretso tayo dun sa gadget-free meal time. Ayan, yung katulad ng sinabi ko kanina, kapag kakain tayo or kapag katulad ng kinuwento ko rin kanina na kapag kami kumakain, ay hindi kami allow mag-cellphone. Sabi nga ng tita ko, kasi ako milig talaga ako mag-picture, aminado ako doon sa pagkain. Kasi para sa akin, kapag nagpipicture ako, it's a memories. Diba? Hindi mo naman na mababalikan yun. At least, tumanda man ako ng tumanda, meron akong mai-share na, ito yung favorite namin pagkain. Ayan, 10 years from now, syempre alam ko nandun pa rin yun sa akin. Masishare ko pa din yun, di ba? So, yun yung akin. Pero, sabi ng aking tita, yung tita ko kasi is medyo ayaw niya lang si cellphone talaga pag kumakain kami. Gusto niya walang cellphone at all. Ayan. So, focus mood. Ayan, focus mood. Kailangan mag-focus din tayo minsan dun sa mga bagay. Katulad na lang sa paggamit natin ng cellphone, di ba? Minsan kasi ang tendency natin kapag gumagamit na tayo ng cellphone, naka-steady na tayo dun sa isang gawain lang eh, di ba? Yung hindi na natin namamalayan na nakakalimutan na natin gawin yung iba, di ba? Halimbawa, minsan meron tayong trabaho, di ba? Meron tayong work-related. So, kailangan, kung meron tayong trabaho na ginagawa, wag muna tayo magsi-cellphone. Lalo na mahilig dyan mag-Candy Crush, mahilig dyan yung mga bata, yung mga nagro-Roblox dyan. Di ba? Yung mga mahilig mag-Roblox dyan. Di ba? Importante na mag-focus muna tayo kung talagang doon tayo sa time na pag-aaral muna, okay? Ayan, prioritize real-time relationships, so alam na natin yan. Social media, ayan, kailangan din natin yang magkaroon din tayo dyan ng boundaries. Taking a digital detox, ayan, so kailangan minsan maglaan tayo ng araw na hindi tayo masyadong nagsi-cellphone o nagagadget para kahit papaano napapahinga rin yung ating mga pag-iisip. And digital ground rules. Ayan, importante po ito lalo na sa mga parents, 'di ba? Kayo po mga parents, minsan po hindi niyo po namamalayan yung mga anak ninyo ay masyado nang naka-focus sa pagsi-cellphone, 'di ba? Sa pagla-laptop, sa pagta-tablet. Okay po? Okay po. So yun po ang aking discussion regarding po dito sa mental health. So thank you po. So iiwanan ko po kayo ng isang quote na wait lang po. Anything that's is mentionable and anything that is mentionable can be more manageable. When we can talk about our feelings, they become less overwhelming, less upsetting, and less scary by Fred Rogers. Muli po, maraming salamat po sa inyong pakikinig. I hope po na naka-impart ako sa inyong na mga magagandang karanasan. Marami po kayong natutunan sa akin. At I really appreciate po lahat po ng nakikooperate sa akin dito sa akin pong discussion. Muli po, thank you and aja! Thank you, Ms. Rose, and take it away.
Thank you so much, Sir Bello. I know marami ka pang gustong i-share. However, meron tayong times constraint. So next time sana ma-invite ulit namin ikaw to share pa yung ilan sa mga hindi mo pa na-mention today. So at this time, let me request naman Sir Gilbert Mendoza to continue with the healthy tips or healthy, what do you call this?
Okay, psychological mental health, ma'am.
Okay. Sorry,
Aba,
sorry po sa
psychological,
psychosocial.
mental health, and psychosocial support system po. All right.
Okay po. Go ahead. Take it away, sir.
So thank you po, Ma'am Roseanne. So magandang hapon po ulit sa lahat. I know medyo pagod na tayo. Sige, bibilisan po natin yung talk ko. But I'm pretty much sure na makakuha kayo ng ibang magaganda ring idea on how are we going to battle or combat the said pandemic right now. All right. So let me present first my screen. All right. Share now. Ayan. So nakikita na po yung aking presentation. Ma'am Roseanne.
Yes po, sir. Yes po.
Okay po. Thank you po, ma'am. Okay. So, ayan. Ayan. Sige. So let's start na po. So my topic for this afternoon po is about also mental health and psychosocial support services, or MHPSS, psychological first aid for teachers and parents as well as the students also. So before I start with my talk, I need all the cooperation of the teachers as well as the parents that are in here right now. And kung meron din pong mga estudyante, pwede rin pong sumali. So mas maganda po kung meron participation sa inyo mamaya para po at least mas maganda yung ating magiging flow ng talk. Alright? So before I start my talk this afternoon, let me ask you first. Okay? All right, before I start, welcome po muna pala. So before I start ulit, let me ask you this question first. How are you today? Okay? How are you? Kamusta po kayo? Okay? Meron po bang pwedeng magsalita kung kamusta po kayo? Sige, magtatawag na lang po ako. Sige, Ma'am Roseanne po muna. Ma'am Roseanne, kamusta ka po today?
Okay, sir.
Okay, alam kong
Great.
pagod na rin kayo, no? Great. All right. So,
Yes,
maganda pong salita yan, yung salitang great po. Okay? Maganda pong salita yan, and I hope everyone are okay despite of the fact po that we are now facing the biggest challenge in our life, which is fighting this COVID-19 pandemic. So, ngayon, meron po akong ipapakitang larawan sa inyo. Okay? Who am I? Base po sa larawang inyong nakikita po sa inyong screen ngayon, sa lahat po ng mga tao na nariyan po sa isang punong iyan, alin po ba kayo diyan? Kayo po ba yung taong nakalambitin? Okay? Kayo po ba yung taong kayo po ba yung taong nakatayo habang tinutulungan yung isang tao na makaakyat sa puno? Hello? Okay.
Yung nasa tuktok po.
Okay, very good. Bakit yung nasa tuktok? Sino yung nasasalita? Sorry, hindi ko makita. Okay. Bakit nasa tuktok yung sagot mo, anak? Bakit yan yung iyong nagiging sagot? Bakit yan ang gusto mo? Okay?
Dahil ang
Sige. Dahil
ang buhay ko po ay masaya, nag-aaral po ako ng mabuti.
okay, very good. Dahil nag-aaral kang mabuti, ikaw ay nasa tuktok dahil po marami kang natutunan, di ba? Marami kang natututunan sa iyong mga teachers. So, nandyan ka sa taas dahil later on, alam mo sa sarili mo na after mo makagraduate sa iyong pinag-aaralan, okay, sa iyong mga kursong maging, iyong kursong gusto na maging paglaki, okay, makakagraduate ka at alam mong ikaw ay magtatagumpay. So yan ang gusto mo. Sino pa kaya sa mga teachers? Okay? Ma'am Roxanne, alin ka ba dito sa mga Roxanne Ignacio, alin ka ba dito sa mga taong nakatayo dito sa may punong ito? Ma'am Roxanne? Alam ko nariyan si Ma'am Roxanne. Walang sumasagot? O sino pa kaya? Sino pang gustong makapag-impart? Dapat po may participation po tayo para mas maganda. Okay? Okay, sige, si Ma'am Mary Denise Joyce na lang po. Ma'am Mary Denise, isa na lang po. Okay? Ma'am Mary Denise, andyan ba si
Hi,
Ma'am?
sir. Good
Hello po.
afternoon.
Good
Nandito
afternoon.
po.
Sige po, Ma'am.
For me, sir, I think, ayan po, yung, wait lang ayan, siguro yung pinaka-lower part na lang, yung may tinutulungang umakyat.
Okay, bakit yan po ang inyong pinili, Ma'am?
For me kasi, sir, alam naman natin that no man is an island, no? So, talagang, para always, tumulong sa iba. Parang gusto ko na hindi lang ako yung nagiging successful. Gusto ko pati yung mga friends and family ko on my environment. Gusto ko pati sila umaangat.
Ayan. So, napakamatulungin po ni Ma'am Mary Denise. Napakaganda po ng iyong sinabi, Ma'am. Okay, so maraming salamat po sa mga nag-impart. So, lahat po tayo, mga ma'am and sir, mommy, daddy na nandito po ngayon, mga bata, lahat po tayo ay may kanya-kanyang mga tinatahak po na mga landas. Tama po ba? Lahat po tayo ay may kanya-kanyang mga problema. Di ba? So, kung kaya't, lahat po ng mga problema ang ating kinakaharap po sa buhay, minsan po tayo rin ay nahihirapan. Tayo rin po ay namumroblema kahit tayo po ang kumbaga kahit tayo po ang provider, namumroblema din po tayo. Okay? So dahil sa mga problemang po iyan, okay, minsan kailangan din po nating mag-reflect sa mga sarili natin. It's time to reflect, okay, with yourself. Kailangan po nating mag-reflect. Bakit po natin kailangan mag-reflect? Okay, mamaya po malalaman niyo po yan lahat. But before that, I have here 5. Okay, 5 rules on how are we going to reflect po. Okay? Number 1 rule po is the self-care. Okay? Pangangalaga po sa sarili. Alagaan po natin yung ating sarili. Tandaan niyo po yan. Yan yung isa sa pinaka-importante. Yung pag-aalaga muna natin sa ating mga sarili. Alam niyo ba, we can share with others a resource that we lack ourselves po. That's the critical start po ng mental health temperature. Hindi po natin pwedeng ibigay yung mga bagay-bagay po na wala rin po tayo, na hindi rin po natin kayang ibigay. Okay? Self-reflection will allow you to make meaning of what is happening. Use technology to remain connected with family and friends. And if possible, pursue your hobbies. Okay? Marami po tayong natutunan base po sa ating lalabanan sa panahong ito, yung pandemya. Okay? So, yung pag-self-reflect po, mga mommies and daddies, ma'am, sir, okay? Yan po yung isang pwede nating gawin para po at least makapag-isip po tayo ng tama. Okay? Para maisip natin kung ano ba ang dapat nating gawin sa mga nangyayari sa ngayon. Tandaan niyo po yan. Number 1, self-care. Number 2, ask for help when you need it. In many cases, we can find support we need from our partners, sa mga asawa po natin, sa mga parents natin, children, friends, and other closest to us po. Yan po yung isa sa mga dapat nating kailangan. Kung saan, sa ngayon po, sa mga panahon po na ito, ay ginagawa natin. We all do right now. And don't hesitate to seek or ask for it. While it's important to keep in your own emotional state in mind, remember that practicing self-care doesn't mean being self-centered. Yung pangangalaga po sa sarili mo, hindi po natin masasabi yan na yan po ay ang pagiging makasarili. Nagiging self-centered ka dahil hindi ka na po nakakatulong sa kanila. Hindi po ganon. Tandaan po ninyo na pag kayo po, as provider, bumagsak, sinong mas lalong mahihirapan? Siyempre, yung mga taong nasa likuran mo. Yung mga taong umaasa po sa'yo. Kaya kailangan pong alagaan mo ang iyong sarili para po mas lalo kang makapagbigay ng tulong sa kanila. Huwag mong hayaan na ikaw mismo ay bumagsak. Number 3, Ask others, how are you? Kagaya po ng ginawa ko sa inyo kanina. Okay? Na bago po ako nagsimula, tinanong ko muna kayo kung kamusta kayo. This is the question that help us take the mental health temperature of others, which means we really listen to the answer, even though that may not be our habit. Everyone is grieving. Everyone is experiencing trauma and needs other people to talk to. We need to feel heard. Tandaan niyo po yan. Kailangan din po natin na marinig po tayo ng iba. Wag lang yung puro tulong lang po. Okay? At pinakamaganda po sa lahat, ikaw po, halimbawa, ikaw yung nasa magandang kalagayan. Kahit sabihin natin wala po kayong maibigay na magandang tulong sa kanila, let's say financial help, na wala po kayong maibigay na tulong na ganyan sa kanila, sa simpleng tanong lang po, kamusta ka? Ay napakalaking bagay na po yan. Naranasan nyo na po ba na kayo po ay nakapagbigay ng iyong mga saloobin sa isang taong nagtanong sa iyo ng mga ganyang salita? Pagkatapos mong naibigay ang iyong mga saloobin, ang iyong mga nararamdaman sa pamamagitan ng pagsasalita sa kanya, di ba? Ang laking ginhawa. Ang laking ginhawa po ng iyong mararamdaman. Ang laking relief ang iyong mararamdaman. Number 4, look for the positive and say it out loud. Now is the time to have the courage to be enthusiastic. Express appreciation. Give compliments. Call out triumphs no matter how small. And if you see something good, speak up. Kung halimbawa, kung may nakita kayong maganda na ginawa ng inyong mga kasama, pwede nyo sabihin na, ay, ang ganda ng ginawa mo. Oh, pwede ko bang gayahin yan? Ganon. Let's say, for example, may tumulong sa iyo. Express your appreciation dahil sa mga tulong na ibinigay niya sa iyo. Give compliments also. Okay? Papurihan mo ang mga taong nagbigay ng tulong sa iyo. Di ba? Kasi dahil sa mga taong iyan, ikaw ay natulungan nila. Dahil sa mga taong iyan, ikaw ay nakasurvive sa mga bagay o sa mga problema ang kinakaharap mo. Last, rule number 5, care for others. You know, we still have a long, hard path to get through this pandemic. But doing our best to manage the toll it takes on our mental and emotional health will make it easier to ride out the coming ups and downs. Kung marunong po tayong, kung halimbawa kung maganda pong ating mental health, marunong tayong, alam natin kung ano ang mga nangyayari sa atin, alam natin kung paano i-combat ang mga nangyayari sa atin, naku, napakadali lang po yan. And I myself experience it. The only thing na ginagawa ko po talaga, ay talagang nagtitake rest ako. Okay? Pumupunta ako kung saang lugar na gusto ko. Halimbawa, kasi yung isa sa nagiging hobby ko is yung pagdadrive. Okay, yung pagdadrive po na yan ang isa sa nakaka-relieve sa akin kasi halimbawa nakakakita kasi nature lover po ako. Nakakita ako ng magagandang views, nare-relieve ako. Then after that, alam ko na may sapat na lakas na ako, nakapag-rest na ako, muni-muni na ako sa sarili ko. Then it's time for me to come back and fight for the problems that I have. Iba po ang ating kumbaga iba po ang ating pag-iisip kung tayo po ay nakapag-relax, kung tayo po ay nakapagpahinga. You know, we need the people on the front lines rescuing the physically afflicted. But the emotional aspect will affect everyone. Yan po yung isa sa pinaka-problema talaga. Yung pinakamahirap ng problema is yung mental health mo. Kapag hindi po yan stable, hindi po yan balance, kumbaga, kapag hindi yan balanse, pwede kang bumagsak. All of us need emotional responders. Kung kaya't, take good care of yourself because we need you and someone needs you. Tandaan niyo po yan. Now, pumunta po tayo sa tinatawag po nating nurturing spirituality. So kapag narinig po ninyo, nakita po yung salitang nurturing spirituality, okay? Ano po yung naiisip mo? Okay? Ano po ba yung naiisip ninyo? Magtatanong po ulit ako. Ano po ba yung naiisip ninyo, Ma'am Aida? Ma'am Aida Lingolyoso. Kapag narinig nyo po yung nurturing spirituality, ano po yung naiisip mo, ma'am? Andiyan po si Ma'am Aida. Ma'am.
Andito po.
Ay po.
May recitation.
Opo, ma'am.
Joke. Kasi pagdating sa spirituality, yung mga pinagdadaanan natin ngayon, isa talaga sa magiging malaking tulong sa atin is yung pagkakaroon natin ng matibay na pananalig sa Diyos. Na kahit ano yung pagdaanan natin, hindi dapat mawala yung faith natin kay God.
Oh, yon, very good. Thank you po, ma'am. Yung faith po natin sa ating Panginoon, isa po sa mga katulong sa atin yan. Para ano po? Para po tayo ay mabalanse. So kapag sinabi po nating nurturing spirituality, mga ma'am and sir, mommy and daddy, kids, yan po ay yan po is the process of finding a balance. Yan po yung proseso kung paano natin mababalanse. So yung sabi ni Ma'am Aida kanina is yung paghingi po ng tulong sa ating Panginoon. Yan po ang way niya kung paano niya mababalanse ang kanyang sarili. Okay? Kagaya po ng nasa larawang inyong nakikita. 'Di ba? Yung batong iyan ay balanse. Subukan yung tanggalin po yung maliit na batong sa itaas. Sa tingin niyo magiging balanse pa? Hindi na po. Babagsak po 'yan. Babagsak po 'yan. Same as true sa mga at sa atin. Okay? Sa ating mga tao. Kapag bumagsak po tayo, kapag hindi balanse po ang ating mentalidad, mental health, possible po na tayo po ay bumagsak. Babagsak po tayo talaga. Marami pong mga tao na nasa rurok na po ng tagumpay, ngunit may problema po sa mental health, minsan problema sa pamilya, bumabagsak po sila. Dahil po dyan kasi hindi po balanse. Hindi po balanse ang lahat. Ngayon, nurturing spirituality is the process of finding a balance to myself, to ourself, and present situation. Okay? Ano yung present situation? Yung paglaban natin sa COVID-19 pandemic. So paano ba natin mako-combat yan? Paano natin malalabanan yan? Paano ba natin lalabanan yung paano natin mababalanse ang ating sarili? First, nagagawin po natin, take a rest. Kagaya ng sinabi ko po sa inyo kanina, kapag kayo po ay nasa isang laban, tingin nyo mananalo kayo na kayo po ay pagod? Tingin nyo mananalo po kayo sa isang laban kung kayo po ay pagod, wala sa tamang pag-iisip? Hindi po tayo mananalo. But take a rest. Okay? Matulog ka. O di kaya pumunta ka sa mga lugar na kung saan alam mo sa sarili mo na ikaw po ay makakapag-relax. Okay? Then after nakapag-relax ka na, nakapag-rest ka na, it's time for you to come back. Tandaan niyo, ang problema po ay nariyan lang yan. Nandyan lang po ang problema. Okay? Kapag yan po ay inisip natin ng inisip, okay, na wala naman tayong ginagawa, hindi po mababawasan yan. Pero kapag tayo po ay nakapag-relax, nakapag-muni-muni sa sarili natin, pwede tayong bumalik na. Halimbawa, may puwersa na tayo. Makakapag-isip na tayo ng tama. Pwede kayong bumalik sa problema nyo. At siguradong makakapag-isip kayo ng tamang kaisipan, ng tamang way kung paano mo makombat o kung paano ka makaget rid sa kanyang klaseng problema. Pangalawa, try some of those new but truly old practices of meditation, mindfulness, and deep breathing. Okay? Hindi po ako mahilig sa meditation. Okay? Pero ito yung isa sa pinaka-totoo, totoong pwedeng makatulong sa atin kasi ito po ginagamit ko ever since when I was still in college. Nag-aaral po ako. Deep breathing. Kapag may problema ka, let's say for example, nakapag-aral ka, ngunit ikaw ay kinakabahan dahil sabi mo, yung mga binibigay na test ni ma'am or sir, di ba? Ay napakahirap. O di kaya yung problemang binibigay sa akin ng boss ko, Yung mga trabahong binibigay sa akin ng boss ko ay sobrang hirap. Okay? Do deep breathing before you start. Inhale through nose, exhale through mouth. Do it 3 times, 4 times, or 5 times kung gusto ninyo. And for sure, marirelieve po kayo. Napakaganda po niyan. Deep breathing is one of the best practices na pwede makapag-relax po sa ating utak, sa ating mga katawan. Next, spend some time finding reasons to have gratitude. Ito yung sinabi ni Ma'am Aida kanina. Okay? Yung pagpipray. Kayo ba, nananalangin lang po ba kayo kung may kailangan kayo? Siguro most of us, siguro ganun yung ginagawa. Nananalangin kung may kailangan lang po tayo. Pero wag po ganun. Manalangin po tayo kahit wala po tayong kailangan. Kahit hindi po tayo makapunta sa simbahan. It is not necessarily mean na kapag hindi po kayo nakapunta sa simbahan, kayo po ay hindi na, o kumbaga wala na kayong God. Pwede naman po kayo diyan sa loob ng bahay ninyo. 'Di ba? Meron kayong santo. Pwede kayong diyan sa gilid, mag-pray po kayo. Humingi po kayo ng kapatawaran sa lahat ng kasalanang ginawa ninyo. Humingi po kayo ng pasasalamat sa lahat ng mga bagay na binigay niya sa iyo. 'Di ba? Isa po 'yan sa pinakamagandang gawin. Yung pagpapasalamat sa buong may kapal. Kasi alam kong siya yung pinakaunang pinupuntahan natin ever since kahit ako. Bago ako magsalita sa aking asawa, bago niyan, matutulog kami sa gabi, nagpipray muna ako. Ganun po yung ginagawa ko. Do something kind for someone else. Yan po, isa sa pinakamaganda. Kahit sabihin po natin wala po tayong may tutulong. Pero yung paggangamusta po sa isang tao, yung pagkamusta kung kamusta na siya, kung ano na ba yung kalagayan niya, okay ba siya, yun po, maganda na po yun. Maganda pong ugali yun. Kasi once na yung taong iyon ay nakapag-share sa iyo ng kanyang problema, nakapag-share sa iyo ng kanyang hinanaing, malaking relief po yan sa kanya. Napakalaking relief na po yan sa isang taong mayroong malaking problema. Okay? Yung pagbigay nyo rin po ng magandang advices sa kanya. That's one of a kind thing na pwede ninyong gawin sa isang tao kung hindi man po monetary yung may bigay ninyo. Maganda po yan. Next. Chose to forgive or confess as need requires. Yan yung isang ugali na meron po ako. Diba? Kapag mayroon po akong nagawang hindi maganda, at alam ko sa sarili ko na talagang mali ako, yan po talaga, inaamin ko po yan at humihingi po ako ng tawad. Hoping na sana kayo din po ay gawin ninyo. Bakit? Yung pagpapatawad po sa isang tao o yung paghingi po ng tawad sa lahat ng taong inyong nagawa ng kasalanan, malaki pong ginhawa ang pwedeng maibigay niyan sa ating nararamdaman. Na-try nyo na po ba yan na humingi po kayo ng kapatawaran sa lahat ng mga kasalanan ninyo, di ba? Nagiging maganda ang inyong pakiramdam. And I hope yan po ay magawa po natin dahil napakaganda po niyang mga gawain. Next, sa susunod ko pong gagawin, mayroon po akong ipapa-activity sa inyo wherein pwede nyo pong magawa within 3 minutes lang. Yung activity na po yun, right after 3 minutes po, kukuha po ako o magtatawag po ako ng mga tao na pwedeng mag-share kung bakit yun ang kanyang ginawa. Alright? So, para po sa ating activity, mga mommies, mga mom and sir, para po sa ating activities ngayon, may output po tayong kukunin ha. Important reminders po. Okay? The things you need is bond paper and coloring materials kung meron po kayo. Next is ball pen or pencil. Alam niyo po, tandaan niyo, huwag niyo pong kakalimutan, you are the master of your art. Huwag po kayong mahiya ha. You can be creative as much as you like. Remember, all art is good art. Alright? So napakadali lang. Bibigyan ko po kayo ng 20 seconds para po i-prepare yung inyong mga gamit. Kasi pagkatapos po nito, kukuhanin ko po yung inyong mga output. Okay? 20 seconds starts now. Alright. So, ayan. So, again, let's go on na po. Ito na po yung pinakahuli. Huwag po kayong mag-alala. 3 minutes is enough. Napakadali lang po ng ating gagawin. My faith. Draw at least 3 candles. Each candle represent before, during, and after pandemic. How was your faith help you to overcome or will overcome your situation? Siguro, kaya natin tapusin ng 3 minutes. So, bibigyan ko kayo ng 3 minutes para po at least matapos yan. Napakadali lang. Candle. 3 candle lang. At pagkatapos niyan, mag-share po tayo ng ating mga output, ng ating mga gawa. Alright? Siguro kukuha lang po ako ng mga 2 o 3 pwedeng magsalita para at least matapos po tayo. Or 2 na lang para at least matapos natin agad ito. Isang teacher at saka isang student or parent ang kukunin ko. One minute and 30 seconds. One minute left. Okay, alright. So alam ko siguro meron na kayong nagawa. Siguro meron na kayong nagawa. Di ba? So gusto kong makita. Sino kaya ito? Okay, so sige, magtatawag ako ng teacher ha, na gumawa po ha. Sino kaya? Okay. Sige, tatawagin ko po si... Andito ba si ayan, kasi idol na idol ko po ito, lalo na pag nagsasalita. Andiyan po si Ma'am Konkon. Ma'am Konkon, nandyan po ba?
Yes sir, andito po ako sir.
Ma'am? Opo.
Yes sir, nandito po.
Ayan ma'am, pwede ka po ba makapag-share sa amin ma'am ng gawa mo po?
Sir,
Apo.
nakagawa po ko kaso lang po walang color.
Okay lang po ma'am.
Wala pong
Okay
color.
lang po,
Do I have to show po ba yung gawa ko or ano?
Pwede rin po ma'am kasi nakikita rin po namin yung ano niyo po dito ma'am.
Ah, okay.
Ayan.
I don't know kung
Ayan.
nakikita po ba?
Nakikita po ma'am. Po.
Oo.
Napakaganda.
Nag-ano po kasi ako syempre nag-start po ako doon sa medyo malaki yung candle, tapos lumiit ng lumiit. Kasi ang thinking ko naman po, syempre nag-umpisa ka sa candle na to, alangan naman doon sa susunod yung during mo, biglang lumaki siya, di ba? So ang ano ko lang po doon, parang ang nagre-represent ng faith ko is yung yung mismong light, yung mismong light na nanggagaling doon sa candle. Parang yun yung ano ko. So doon po sa umpisa, so ayun na po yung faith na meron ako doon sa umpisa. Tapos doon sa pangalawa, doon sa during ko, syempre po nabawasan na yung candle. Pero po yung faith na meron ako, nadagdagan siya, naging stronger siya. And doon sa future po, yung after, because of the experiences na nangyari during the pandemic, lalo pa siyang nag-glow pagdating na nung after. So yun po yung ano ko kasi actually although marami po tayong experiences ngayon during the pandemic na talaga namang panghihinaan ka ng loob or talagang parang yung feeling ng hopelessness, mawawala pa ba to? Ano ba mangyayari sa atin after? Parang ganon. Pero actually, yun nga po yung sinasabi ko na during those times na very weak tayo, doon talaga nagmamanifest yung strength ni God sa buhay natin. So parang ganun po, the more na may pinagdadaanan tayong mahirap at the present time, mas lalo po nating nararamdaman yung yung kung paano tayo tinutulungan ni God doon sa experience na meron tayo. Kasi yung the more na natanggap mo sa kanya na blessings, the more na nararamdaman mo kung gaano yung impact niya sa buhay mo. Tapos yun din yung magiging way na parang magiging sharing mo sa ibang tao. Kasi ikaw, nakatanggap ka ng ganong karaming blessing. So, freely, i-share mo din kung ano yung meron ka. So, yun po yung sa akin. Parang mas lalo na yung sharing ng light mo after ng pandemic. Pero it also shows in my drawing na after all this, meron pong hope. Naniniwala ako na matatapos din lahat ito and then yung glow ng light ko talagang mas lalo pa after the pandemic. O yun po.
Ayun. Thank you po for that napakagandang message po na ginawa po ni Ma'am Konkon tungkol po doon sa kanyang ginawa. Napakaganda po. Idol na idol ko po kasi talaga yan. At saka talagang matulungin po si Ma'am Konkon. Yan. So yung ibig sabihin yan talaga kahit gaano man po na problema ang ating kinakaharap, yung faith po natin ay yun po dapat ang lalo po nating palakihin. Yun po dapat ang lalo nating palakihin para po at least kasi siyempre si God lang po ang isa sa pwede nating puntahan lalo na pag may mga problema po tayo. So ang faith po natin yung faith natin sa kanya, yan po yung wag natin walain. Bagkus yan po ay mas lalo pa nating palakihin po. Alright? So, okay, sige. So, sino po sa mga parents ang pwedeng mag-impart ng kanilang mga gawa? Sino po? Okay, sige, Queenie. Ayan si Queenie na very active, very good anak. Go, Queenie.
Sir, ang pagkakaintindi ko po ay yung my faith and prayer are powerful because it can give me luck at the same time strength during and after the pandemic.
Okay, very good. So napakaganda rin ang gawa ni Queenie. Kasi yung kanyang faith ay yung nagbibigay sa kanya ng lakas para at least labanan yung mga kanyang kinakaharap na problema. Okay, so napakaganda po ng ating naging activity at maraming salamat po kay Ma'am Konkon, kay Queenie. Hindi ko po kasi lahat matawag dahil po limited na lang po yung time natin. So ngayon, before I end po my talk to this afternoon, Let me share po this simple quote po from fanzumo.com. When life gives you 100 reasons to break down and cry, show life that you have a million reasons to smile and laugh. Stay strong po mga mommies, teachers, at mga kids. Malalampasan din po natin ito. And from that, maraming salamat po sa pakikinig. Thank you so much po.
All right, so thank you so much, Sir Gilbert, for that very inspiring talk. Also to our other resource speaker earlier, Sir RV and Sir Binala. Truly, this day has been very fruitful. Okay, so by the way, do you have any questions or clarification regarding the talk of Sir Gilbert and Sir Bello, children, or to our parents and teachers? Meron po ba tayong mga questions or clarification bago tayo mag-proceed with the last part of our program?
Salamat po.
Okay, so if not, I guess that will be all for today. So to end our program, let us have the awarding of certificates. Allow me to call Miss Donisa, Haina, and Magbanwa once again for the awarding of certificates of recognition.
Thank you, Ma'am Rose Ann. Thank you very much, Sir Bello and Sir Gilbert, for sharing your expertise views. So let me read the citation of the certificate. Department of Education, Schools Divisions, Office Manila, Margarita Rojas de Ayala Elementary School, A. Francisco Corner Arellano Street, Santa Ana, Manila. Certificate of recognition is presented to Isabelo V. Binala Jr. and Sir Gilbert P. Mendoza in grateful recognition for his invaluable service as resource speaker during the virtual webinar on promoting digital well-being and for his outstanding contributions to the success of Brigada Eskwela 2021, Bayanihan para sa Paaralan. Given this 13th day of October 2021 at Margarita Rojas de Ayala Elementary School, Santa Ana, Manila. Signed, Ma'am Abigail A. Banigon, Brigada Chairperson, Master Teacher in Charge, Ma'am Lea D. Escanio, and Rosemary B. Ponce, our school principal. Thank you very much, Sir Bello and Sir Gilbert.
Congratulations
Salamat
po.
din po.
Alright, so to formally end our program, please welcome Miss Sheila M. Lucerna, Master Teacher 1 for the closing remarks.
Thank you so much po, Ma'am Toston. At Brigada Eskwela Team, congratulations sa isa na naman pong successful na webinar at for sure maraming natutunan ang ating mga audience, ang ating mga magulang, mga bata, ang mga teachers para makapag-cope tayo sa stress, lalo na ngayon dulot ng pandemya. Siyempre, sa tulong yan ng ating magagaling na speakers. Maraming salamat po kay Mr. Retoriano, kay Sir Mendoza, and kay Sir Bello. Thank you so much po. Mga mommies, daddies, mga ma'am, mga anak, sana yung mga natutunan natin kapag meron tayong kakilala na nag-undergo ng stress sa panahon ngayon, tulungan natin sila ha. Huwag kayong mahiya na maglaan ng panahon, ng oras para matulungan natin sila kasi yung tulong na maibibigay natin sa panahon ngayon ay napakalaking bagay para malagpasan nila kung ano man yung pagsubok or yung stress na pinagdadaanan nila ngayon. Muli, congratulations po, Team Brigada Eskwela, and sa buong paaralan, sa buong bumubuo ng paaralan ng Margarita Rojas de Ayala. Congratulations po, and thank you so much po sa paglalaan ng oras na makinig at mag-participate sa webinar na inihanda po ng Margarita Rojas de Ayala Elementary School. Thank you po and goodbye.
Thank you, ma'am. And that concludes our today's webinar series. I hope you've learned so much and had fun. Once again, this has been your
Thank you
host,
po,
Miss
Miss Abby and Ma'am
Rosan.
Rosan, for the trust. Thank you, everyone.
Thank you much,
Picture tayo.
everyone. Okay po, paki-turn on na lang po ng camera for the photo op.
Congratulations, Sir Mendoza and Sir
Thank you po, Ma'am Abby.
Binala.
Tagal. Ang tagal niya. Salamat po. Si Ma'am Sen.